Good morning, and welcome to day 2. Thank you all for coming, and thank you for taking the time to come in early this morning. So Dominique and I will be providing you some of our recollections from what happened yesterday, and if we have time, we'll listen to your contributions to that effort. And I wanted to start by thanking all the presenters yesterday. You did a great job. Thank you from the organizers for your effort and your work to put those together. And I hope that all of us are looking to take something back when we go back home. Before I go further, I want to do one more thing. We have about 10 participants from 8 African countries attending under the auspices of a scholarship from IAPHL, that's the International Association of Public Health Logisticians. And I wanted us to meet them because we could, if you had the time, stop by, chat with them, find out what's going on the ground in their different countries. So I'll start with Rebecca. Is she here? Please, when I call your name, please stand up and remain standing. Can I say Rebecca? Okay. Peter, is Peter here? Peter Babagomira. Okay, she's not here. Okay, is Veronica Dean from Sierra Leone here? Please stand up. Chima Amadi from Nigeria. Andeatso Kefasi from Nigeria, he's not here. Joel Simbeye from Gam, thank you. Fantaye Teka from Ethiopia, and Sion from Ethiopia. Did I leave anybody out? No? Oh, I left you out. Kwado from Ghana. Sorry. Please, could we just give a hand for these young guys? Thank you. I think I'll hand over to Dominique now, who will start off with our slides, and I'll come back in a moment.
Yeah, thank you. Okay, thank you, Liz. There we go. So good morning, and also welcome to day 2 of the 2018 HHL conference. My name is Dominique Swinkels. And I'm the executive manager of the People That Deliver initiative. If you do not know what the People That Deliver is, I'm just going to give you a little background. It's a global advocacy initiative that was created in 2011. And it focuses on advocating for human resources, for basically a systematic approach to human resources in supply chain management. We're very much a solid community of over 250 organizations, with a board of about 23 organizations that covers 7 constituencies from the private sector to donors, aid agencies, academic institutions, and NGOs. We're a proud new co-organizer of the HHL conference this year, together with IPHL. So I just wanted to mention that yesterday we heard from Jagan Chapagain, the Undersecretary for Programs and Operations of IFRC, that it was the 100th year anniversary of Nelson Mandela. And therefore, I think it's a really good time to reflect on his life and his legacy and all the work that he's done in the social justice area. And so I just wanted to reflect on that. We also interestingly heard from Dr. Maha Barakat, the former Director General of the Abu Dhabi Health Authority, that it is the 100th year anniversary of the founder of UAE, and his name was Sheikh Zayed bin Sultan Al Nahyan. And so I thought, let's commemorate that as well. So both of those are up here on our slide. So yesterday, interestingly, we also heard from Pinar that this is really one of the very few conferences that tackles that intersection between both the health and humanitarian systems, and as those two really need to work together. And also that over time, the conference has moved from natural and man-made disasters all the way now to working on issues within health system strengthening and health emergencies. And then also I thought was very interesting that we find that there's over 120 organizations represented here today at the conference. And then just wanted to reiterate the objectives of the conference, to strengthen supply chain and related activities, and to facilitate dialogue across the organizations and the sectors, something that will help organizations set their agendas and priorities. So the key message that we heard from our keynote speaker yesterday is really that there's a huge pressure on the global humanitarian system with huge challenges that stress health systems. There's an overcrowding of humanitarian actors as well. So we need to really come up with global strategies that focus on the whole society, which is really number one of his key takeaway messages. So the whole society approach, really where we're working towards better coordination, collaboration, working with government, public sector, private sector, and then really making sure that communities are at the center. So making sure it's community-centric, putting communities at the center of the action. And then finally, One Health. So considering the whole public health system, not just humanitarian interventions. And I thought also it was pointed to say that there's a number of other strategies. I thought it was interesting that we need to build at the local community level, infrastructure strengthening, there's a need for continuous research, preparedness, of course, as we heard over and over yesterday, and then the engagement with local actors. I loved how he spoke about the religious leaders that we need to work with. And of course, the intersection of the private sector. And then lastly, really, it's that importance of logistics, really moving from the dark basement to the spotlight and taking advantage of new and emerging technologies. That's one of the things we'll be hearing in the panel later in a few minutes. And so I thought it was also important to mention Caroline Hart's tweet yesterday that health services are out, the supply chain is hidden behind. And so I'm going to pass it over to Liz.
Thank you, Dominic. Yeah. Okay. All right. So yesterday during the planning and responding to PEH public health emergencies, we got a lot of information, very interesting information, but I wanted to just mention what I took away from that presentation. I think what resonated with me, among other things, is how the Nigerian Center for Disease Control has worked very hard in spite of all the public health challenges that was experienced over the last couple of years, and how they worked to put together, or begin to put together, some infrastructure to help them be a little bit more prepared for the next emergency when it comes up. I noted that they spoke about effective surveillance, community-based alert systems, network of laboratories, and collaboration among partners. And I wanted to stress that because during the talks yesterday, I think I came away remembering my old commodity security principles that we all know in supply chain, how it's central and vital that there is collaboration, there is leadership. And then, not forgetting the supply chain, actually, and train people to do the work. So that's my recollection that I wanted to share with you. There's plenty of stuff in there. For those of you who attended, you know there was a lot of information in that panel discussion, but I wanted to give you what resonated with me and stayed with me. Now, the second one is the public health system strengthening, and that had, again, two things stood out for me I wanted to share with you. The first one is how leadership and commitment and hard work, in spite of, as was reported, some financial difficulties in Thailand, the Thai Ministry of Health was able to put together this strategy to ensure universal health coverage and achieved it. That stayed with me, and I hope when I come around to ask you what stayed with you, I'll hear something interesting. The other thing that really stayed with me is how Guinea, in spite of the enormous effect on their health system and their economy, they fought back and are making good strides towards improving their infrastructure for meeting, God forbid, the next emergency. It stayed with me that they have more than doubled their financial commitment to that process. So I wanted to open this up to, we have a couple of minutes, to all of you and ask if you have something that stayed with you from yesterday's offerings, would you like to share? Do we have mics around the back? Please raise your hand if you have something to share with the rest of us. Fantastic. It's the lady, the gray. It's a big room.
Hi everyone, good morning. I'm Carolyn Pryor from Chemonics. I really enjoyed the presentation by our colleagues on the South Africa Last Mile project, and it was really interesting to me to learn about how we can leverage the private sector's supply chain in ensuring life-saving commodities reach the last mile as well. So I really appreciated that presentation. Thank you.
Thank you so much. Oh, here's Walter, the guy in the purple thing.
Hi, Walter Proper from JSI. So there's a lot yesterday, but I went to the drone one, and I think one of the interesting things is how we're still just starting. We're in our infancy, and there's so much learning still going on. And one of the key takeaways I got was the fact that you have to put in your agreement with whoever you're contracting with to make sure that they're open about complications. I thought that was very telling and interesting, that when something happened and you're trying to figure out what went wrong, when it does, and we were clear that it will happen, how you have to look at it. Is it mechanical or something else? But if you don't put it in your agreement, your vendor may not be willing to actually share that information. I thought that was a big takeaway.
Thank you so much. Any other contributions? Well, thank you. Dominic, you want to close? Okay. Thank you very much.
So we just wanted to go back to Pinar's points from yesterday morning. It really is a call for action to you. So just to reflect again, what knowledge you can take away and apply for yourself, your colleagues, and constituents. So that's number one. What action will you take coming out of this conference? And then what action will you encourage others to take? So I really wanted to make sure that we reflected upon this again and think about this during the day and then take it back with you, back to your organizations. So thank you for this. And so now we're going to move on to panel 3. So this is the number 3 panel, the first panel of the day, and that is being moderated by Dr. Jared Gensel. So, Jared? Yeah. Do you need that? No?
Nope.
Okay. Okay.
Is this on? Good. Good morning. I'm Jared Gensel from MIT, and I'm happy to be moderating the panel this morning focused on information technology. I'm going to invite all the panelists to come up now. We are not going to have PowerPoint presentations this morning. If you are the kind of person that prefers PowerPoint presentations, then I invite you to join a workshop this afternoon on the same topic around information technology, where we will have demos and PowerPoint presentations around different solutions, software solutions, supply chain software solutions that are relevant to the health and humanitarian sector. I invite the panelists to come up now. 1:30 in room 3 is this workshop where if you want to know more about the features and how the software solutions actually work, talk with the people, interact more, please come to that session at 1:30. This morning, we're going to focus more on a discussion around what are good practices, the process of implementing and using software. What are good practices, the role of standards, how do we have interoperability, the issues of actually making information technology part of a solution that helps you deliver value. So we'll just have a discussion this morning about those topics. We had 2 panelists, unfortunately, before I go into the panelists, I do want to acknowledge and thank Alexis Strader from People That Deliver. She was very instrumental in shaping the nature of this panel and the workshop this afternoon, so give her a round of applause, actually. So 2 of our speakers, unfortunately, couldn't make it. One of them is Tunda Odunlami he's the CEO of GS1 in Nigeria. GS1 is an organization, if you haven't heard of them, they are a standards organization that works a lot with, if you've ever had a barcode scanned at a retail outlet, GS1 is behind the standards that enable all the retailers and product manufacturers to agree on these kinds of barcodes and standards. But they're expanding into a broader set of solutions and standards, including things around traceability and blockchain, some of the new things. Unfortunately, he couldn't get his visa and couldn't join us. Also, Paula Corrado, the Senior Logistics Officer from the World Food Program in Ethiopia, was planning to come and talk about, they've been implementing blockchain and using it in their supply chain in Ethiopia, and wanted to hear about their experiences. There's a lot of talk about blockchain. Unfortunately, she's dealing with urgent priorities at the moment. They have over 1 million displaced people in southern Ethiopia that require urgent logistics support, so she's going to focus on them. And plus, there's a new opportunity with Eritrea and Ethiopia warming relations that there could be a new corridor for bringing goods into Ethiopia, so she's dealing with those. However, since we have a broad audience in this conference, we were able to add a couple of panelists as well. So we lost 2, but we added 2. So the bios for Charan Malammarpuram from Logistimo, who's to my right here, you can read his bio. And we're going to all do intros in a second here, more extensive intros. Sid Rapani, to my left here, from Lamasoft, his bio's there, as well as Tenley Snow, the Open LMIS community manager to my right over here. So those bios are in there. I will just say that the 2 additions are Julie Roshan, who's Director of Impact Business Development for Optel Group. Optel is a company that is working in various markets, delivering solutions around visibility, also incorporating blockchain. So some of the topics that would have been addressed by GS1, Optel's actually working with those kinds of standards to deliver solutions. So she'll talk more about that. And then we have another panelist who should be joining us, Drew Bodapalli from Zipline. They're a drone delivery company, so you think that's not information technology, but they've developed some information solutions around their drone technology, and he would be able to talk about that. So if he comes, we'll add him in as well. So we're going to start by going around and having each of the panelists introduce themselves and their organization. In about 5 minutes, we'll go around so you can get a little more flavor of where they come from, what their experiences are, and then we have a set of questions we're going to talk about as a group, and then we'll have a lot of time for questions from the audience. So be taking notes, pull out your pad and paper and pen and write down some questions. We're going to definitely come to you. We'll have a lot of time for questions and answers around information technology and solutions in your organizations. So let's start by, we'll go to my right over here with Tenley. They're going to talk about their role, their organization, the solutions they offer, their clients, and then a little story about one of their typical clients. So let's start with Tinley.
I had to go first, right, Jared? Okay. Hi, everyone. Thanks so much. My name is Tenley Snow. I serve as the community manager for the Open LMIS initiative. So while I now work with software tools and lots of software developers, my background is not in software. I have a background in English literature. I also studied French for some time, so I kind of talk the software talk now, but I am not a software developer. But after my education, I spent about the last 10 years working in global health and logistics, first with John Snow, JSI on the USA Deliver project, mostly in West Africa. And then most recently with Village Reach and Open LMIS on our global logistics software. So just to tell you a little bit about Open LMIS, I'm sure many of you have heard the name but may not know, all the details about it. Open LMIS is both software and an initiative. The software is currently deployed in 8 geographies, mostly across Africa, where it allows countries to track products within their health supply chains. It's managing those logistics processes at over 10,000 health facilities across Africa, and there are more on the way this year and in the coming years. In terms of the solutions that are offered by Open LMIS, the software manages and automates the Logistics Management Information System, or LMIS, in countries' public health supply chains. And so that means everything from inventory management to cold chain equipment management, requisitions, or automating that ordering process. And we've also recently released an advanced reporting and analytics big data warehouse platform. So lots of sort of exciting new features. It's a broad, full-featured LMIS. I should say that also the software is fully open source, so I'm sure most folks understand what open source means, but that means that you do not have to pay a licensing fee in order to use the software. All code, all documentation, all information is publicly available online. So if you understand coding, you can download the software and start using it yourself. The platform is also built using a modular microservices-based architecture. So what that means is when a country wants to utilize and customize the software, it allows for that ease of customization without having to fork the software. So that's kind of contributing to the Open LMIS vision of sustainability, different countries being able to make customizations and then benefit from the experience in other countries and the development in those other countries. Typical clients of Open LMIS, where the majority of the implementations have been in the past, have been with ministries of health and public supply chains. So again, most of those have been in West Africa, or not West Africa, but Africa generally. But we're also looking forward to engaging more with NGOs, nonprofits, other ways that the software could be utilized. But up until this point, the majority of implementations of Open LMIS have been with public health supply chains with ministries of health. And maybe just to tell a little personal story, we recently rolled out an implementation of Open LMIS in Malawi in 2017 in the summer. It was the first rollout of our newly architected, the version 3 series, when I'm talking about that modular microservices architecture. This was the first deployment of that. And we told the story of a pharmacy technician named Bennett Kalibe, and he's in Malawi. He's in the Chisi district hospital in Malawi, and Bennett usually receives his paper reporting forms from facilities. And so he receives those paper reporting forms, those requests, their consumption, stock on hand, and he enters that data into the newly established Open LMIS electronic system at that district hospital. And because of that system now, which Bennett has described as user-friendly, he now has faster access to better quality data. So he's able to have a broader view of the data at the facilities that he manages. And that has allowed him to make better informed decisions and connect with other logisticians and just generally feel like he's more confident in his work. So we talked to Bennett just a couple months ago, and he's really had a positive experience with the automation of his LMIS in his country. So.
Good, thank you.
Yeah.
Thanks for connecting to the individual user too, like somebody who's getting value out of the solution.
Exactly.
So, we'll move next to Charan here, who does come from a software development background, and talk about Logistimo, also another provider of information systems for logistics.
Hello everyone, good morning. I'm Charan Malay Marpuram, that's how you pronounce it. I'm the Director of Engineering at Logistimo. What I do as a director, I play both architect and an engineering manager role. So I oversee the development of our software platform, which is an open source and SaaS platform. For those of you who don't know SaaS, it's software as a service, so which means we have it deployed and it's running already. You can just come and start putting your stores, inventory items, start tracking, it's all up there. We worry about managing the infrastructure, scaling it, upgrading it. Whenever we get new features, all of that comes out to you. So going back to what I do, and I also oversee the engineering development, making sure that we follow the right quality standards, and then optimizing at the pace at which we are developing, right? And also keeping a focus on the innovation. We do internal things like hackathon to enable certain ideas. So there have been a lot of ideas that came up recently, which I would be glad to share with you later on. And Logistimo itself is as I mentioned, it's an open source SaaS platform for supply chain management. It's a little more than an LMIS system. It's basically, you can model any supply chain management model into the system via MIS, or you have push-pull configuration, you want to use it mixed. It also has inventory forecasting and optimization embedded in it. It comes with a pre-built analytics platform, which give you all the key supply chain indicators at fingertips. And I think if you have attended Kaushal's presentation yesterday, he talked about something called event summaries that we do. It's basically, even though we had all this data available in the system, and there are close to 3,000 metrics, individual metrics across 20,000 dimensions, it's hard for people to go and see what exactly they are looking for. So what we did was to summarize all of this information into a meaningful text. It just says, I have noticed there are 15 stores that have this specific batch item that is going to expire within the 30 days. Would you like to take an action, right? So this helped the district supervisors or the state supervisors to act based on the information. They don't have to spend half an hour to figure out where are the problems in the system. The problems come to you. This is what we call critical indicators. And there's also a complementary feature to it, is to enable motivation in the system, or social nudging as we call it. So a lot of these last mile pharmacists or who are working at the delivery points, they typically are underappreciated when they manage their stock well, right? So what does good stock management mean? You maintain your availability, you maintain all your vaccines or any drug with right quality, right quantity, right? You're doing all your stuff. The system can understand that someone is actually working better. So we surface all this information again through the same summarization process to a supervisor, and then they have this feature to like someone else's performance. What we noticed was people would take this snapshot of like and share it with their own WhatsApp group. They're so proud of it. And others come to us and say, like, how can I become the best performer? How would I get a like, right? So this is really building up the community. And I think one of the key stories is also that they do not necessarily, the users do not see this Logistimo as a system, they just see the data. When we go to them, they talk about, this data has helped me making my decisions optimal, it makes my life easier. No one ever says Logistimo platform helps me. That's actually a very good thing. We do want people to see through the system. They don't talk about our software at all, right? And I think our key offerings, there are 3 pillar services: SEM, supply chain management, and we also have transportation management, fleet. And we do have this crowdsourced transportation management that's being piloted in Karnataka for the last 1 year, where we actually try to do deliveries to the last mile, farm inputs, pharmaceutical inputs, anything. So we do an auctioning-based model, find transporters who can actually take it to a specific village route. And I guess, I think the clients we have across 2 continents now, Asia and Africa. India being our biggest deployment with 18 million birth cohort and close to 80 million children being vaccinated using our solution. And we have multi-echelon deployment, which is the same software that you use across the echelon. There's no different pieces. Everyone has their mobile apps, their web apps. There's a TV app that we put to create social pressure, because some people would not like to do data entry that often. So when they walk into a district supervisor's officer, their name comes up as saying he or she did not enter data in the last 7 days. That acts as a social pressure. That actually improved availability One of our very early projects in 2012-13 that we did, it improved the availability from 67% to 99% within 6 months of just putting a TV out there. Didn't matter what we had in software. So there are certain ways we try to innovate and organize around this. I think few countries, just to mention, India, Zambia, Myanmar, Uganda, and Mozambique is in coordination with Village Reach. We're working on blood sample delivery, especially for HIV diagnostics, using the same crowdsourced transportation model that I talked about. I think I did mention a few stories about how people see Logistimo. It's enabling them. People talk about the data they see, right? They feel empowered. And I would also like to quote the way we try to build our application is human-centered technology. It's bottom-up empowerment. We do not think the use cases from the national level, we think the use cases from the person who is actually going to use this and make it really a digital assistant to them, right? So those are the people who are actually consuming it, and everything else would automatically fall in place. That's about that.
It's good to hear developers talking about use cases, making sure you're thinking about those users at the end.
Right.
So. And you said 67% to 99% availability. Where was that again?
This was in Karnataka, one district. This was 2012 when we piloted. I think that graph is there. Kaushal's presentation has that slide deck. You could take a look at it.
So, I mean, it's just to see the impact of information technology. That's a significant impact on the health outcomes in that district. So let's turn to Sid from Lamasoft. So once we've got our information systems in place and so forth, how do we think about using technology to design and plan for the future? And Sid will talk about that.
Good morning, everyone. I'm Sid Rupani, and I represent Lamasoft. Lamasoft is a supply chain software company, and what we do, we call supply chain design. So I'll explain a little bit more about what we mean by design. We take data from systems such as OpenLMIS and Logistimo's platform, and we want to help you make decisions using that data, decisions about how you set up your supply chain and how you operate your supply chain. So Logistimo also talked about some wonderful analytics that they've built into their platform itself, but we want to take data from a number of different sources and help you holistically design your supply chain. So there's questions like at the high level structure, which is how many warehouses should you have, where should they be, how should product flow through the network, how many trucks do you need, how should they be routed, how much inventory should you hold at each stage in the network. All of these questions together are what we think of as supply chain design. You can choose different answers to all of those questions, and you'll get outputs on cost, service levels, risk. These are the objectives that you care about when you design your supply chain. So what I do for Lamasoft, I work on our global impact team, and Lamasoft is primarily, as a company, we serve big corporate customers, people with large global supply chains, the largest retailers, food and beverage companies globally. But on our global impact team, we work primarily in public health and a little bit in agriculture now. And so we've done work all across Africa, some in Southeast Asia and South Asia, and also in Latin America, helping design supply chains. That's the work that I primarily engage with. And the cool thing is that we've worked with, or in parallel with, or with many of the panelists here. So we've worked with Village Reach on a story I'll tell in Zambia. We're also using some Logistimo data in Zambia, and we have helped Zipline as they think about expanding operations into other countries. So a story, we were asked to say a story. I'll tell the story of Zambia. And this was last year, we were helping design the vaccine supply chain in Zambia for the entire country. And there's a traditional multi-tiered administrative layer vaccine supply chain, national to provincial to district. And then the health facilities generally came to the district to pick up their monthly stock of vaccines and returned. And we were looking at what are alternative configurations? So we could look at, can we skip one of these layers? Can we do multi-stop deliveries with trucks instead of having health facilities come to pick up once a month? What should the frequency of delivery be? So these were all variables that we were considering for change. And these were variables provided by the National EPI program and the Ministry of Health, that they were open to changing, the scenarios that they wanted to consider. Once we looked at all of these in a variety of different scenarios, we suggested that you could do direct deliveries from provincial level to the health facilities instead of having health facilities come to the district to pick up. But the districts would still store a buffer stock of vaccines in case of any stock out at the health facility level. You would have somewhere close you could go to pick up. And we saw that not only would this reduce overall costs, so logistics cost per dose reduced by 14% from our analysis, but also it would save 100,000 hours in the health facility worker time, which is what they were spending going to this is 100,000 hours a year across the country. So that's about 50 full-time workers. So it's considering adding 50 full-time workers if you just don't have them go to the district to pick up. That frees up a lot of time to take care of their actual duties as health workers. And so now this suggestion, or our recommendation, is being piloted. All of this work in Zambia was done with Village Reach and funded by the Bill and Melinda Gates Foundation. So that was a collaboration. And then it's being piloted now in Southern Province, and it's also working in parallel with Logistimo, because the data for the vaccine stocks at district level, there's Logistimo systems that tell you in Zambia how much stock is available where, and they're now expanding, from what I understand, to the health facility level. So that's one example of the kind of work we do.
Thanks, Sid. And I appreciate that your ability to articulate the value proposition, not just, lower stock obviously is good, but not just the cost savings, but the time. A lot of times time is more important. Cost and time are related, but looking at the time and the amount of additional effort that can be dedicated toward other health services is really a good way to talk about that. Thanks. Next to Sid is Julie Rochon. She's joined us from the Optel Group. Optel is and she'll tell you more about it, a company that's been developing solutions for a long time. She joined in 2017 to look at impact business development, looking at how to extend some of those solutions into markets that are relevant to people at this conference. So I'll give her a chance to talk about her background and the company.
Thank you, Jared. Hi, everyone. I'm happy to be here today and jump in for Tunde that we know really well. Those that know Tunde know he does a really good job at public speaking, so I feel really challenged to interest and perform. The Optel Group, we're a solution provider, but we've been in business for 27 years. We're a Canadian company. We're based in Quebec City. We have about 1,000 employees worldwide. We have our headquarters are in Quebec, but we have a plant in India. We have a plant in Brazil. We have another plant in Limerick, Ireland, and we have office in Ivory Coast, Indonesia, and the U.S. We are the leader in the track and trace globally. We have about 25%, a little bit less than 25% of the market. Our major clients are the global manufacturers, and the company itself has been growing really fast in the past few years. What's unique about Optel is that it's owned by one person, and that person's determination when he started the company in his 20s was to use engineering and entrepreneurship as means to be able to improve systems globally. So it came a time where we were looking at the area where we were evolving, where we were deploying vision and inspection systems, as well as serialization in manufacturers. And all of this, was keeping us really busy. But if you look further ahead of you, you know that this doesn't serve anything if you don't go out of the manufacturer. So we started deploying a portfolio of supply chain strengthening technologies that now run from the raw material all the way to the end user. I came to Uptel about 2 years ago. I come from the international development sector. My expertise, my core expertise is in the reinforcement of health systems. I've been in this area for a couple decades and started learning about these new technologies that were out there, and I had not been in that space, and I was looking for novel ways to reach the outcomes that we had been trying to reach in the development projects that I had managed previously. And I heard about Uptel and their vision, and I approached the owner and I said, okay, this is what I want to do in international development, and what is your vision? Because they adopted an identity. It's called a socio-cooperative identity, and I wanted to know what that meant concretely. So the owner shared his vision, and obviously there was a match, and I joined Uptel at that time. My role at Uptel is to, I'm building from scratch what we call Uptel Impact. It's similar to the work that Sid is doing. And we, at Uptel Impact, the primary focus is really on increasing access to affordable, safe, and appropriate medical treatments. Our approach for deployment is really geared towards low and middle income countries. Our focus is sub-Saharan Africa. And we really have two major building blocks to do that, and one of them is engaging with partners and stakeholders in our priority markets, and at the same time, we're developing an impact business development model. We think that we will gain a lot more collectively and also as a corporation if we focus on the reinforcement of the ecosystem as a whole. So this is really the basis of how impact is advancing. Some of you that I've already met know that we've been engaging with, and we're aligning our work with the existing initiatives related to the deployment of GS1 standard and serialization. If we want to be able to track the product in low and middle income country in a way where we're going to reinforce the supply chain, optimize them, and especially secure them, we think that this is the best way to go about it. Now, I did mention something about our clients. They're the clients from our core business. I wasn't involved with the core business, and I'm not able to give you an example of that, but I can tell you, for instance, in India, where we have a plant, we were engaged with the government even before the law, the new regulation came into play, and this is the way we were also working in the US and in Europe with the new FMD, the Falsified Medicine Directive. And we think that it's, even though the impact program wasn't there in the past, it was still in the DNA of Uptel to engage with the stakeholders right from the start. We don't want to provide solution, we want to be part of the solution. So one last thing, if I give you a vision about Uptel Impact and our future clients, we want to to support the adoption of GS1 standard, but mostly the deployment of serialization, so then we can start tracking the products and safeguard their authenticity and integrity as well across the supply chain. So it's really a cornerstone for us to support the local manufacturers because some of them are already involved in supplying key essential medicine in sub-Saharan Africa, and we wouldn't want them to become at a disadvantage if the governments went forward to adopt new regulation to ask for serialized product as a requirement for their procurement. So that's something that we're working on right now. And one concrete example also is we're looking at a way where we deploy serialization, and I'd be happy to hear your feedback on this, that is product-driven. So I'm thinking of a product that touches me personally. It's oxytocin, and now we may have carbutussin coming, but there's a huge issue with the quality of oxytocin in low and middle income countries. The recent studies came out with results that said that 60 to 85% of the time when it reached the mothers in sub-Saharan Africa, it was either falsified or low quality. So we have still major horrendous numbers of maternal mortality due to postpartum hemorrhage. So what we're working on with a partner that is involved with increasing the quality of reproductive health supplies, it's looking at a possibility of developing a group purchasing organization for the serialization of oxytocin. And I can give you more detail, but we did some assessment of how much it would cost per product, and it's surprising when you're working on building the solution specific for these markets that the price for the serialization wouldn't be as bad as we think. So they don't come, we think serialization doesn't come cheap, but if we work together, we can make it happen and make it a solid investment with quick ROI. So I'll stop talking for now, but I'm open for your questions and further discussions.
Thank you, Julie. It's exciting to hear about a company, a global company that's already moved pretty far with this topic of serialization, tracking and tracing across global supply chains, but the focus that they have on not only enabling that serialization for the tracing of health products that are critical in sub-Saharan Africa and those markets, but also working with manufacturers to make sure that they're part of that global system as standards and requirements are moving forward. So it's exciting. Drew has joined us now. So from Zipline, he's the director of national implementations. As I mentioned earlier briefly, Zipline does drone delivery technology, and you wonder why are they on an information technology panel, but they've developed some solutions out of the need of providing a more comprehensive solution. And we wanted to talk with him about their experience with developing those solutions and how they're working with clients to build off of the value of the drone technology with also information to help manage the supply chain better. So, Drew?
Thanks. Very excited to join you all today. So I lead till recently was leading our efforts in engaging with the Rwandan government, working with the ministries and Civil Aviation Authority, but also rolling out the service all the way down to the facility level at Zipline, but more recently have shifted to focusing on partnerships both with private sector actors that provide healthcare, because we can have a real impact on access there as well, and with the donor community as well. So that's my role. So Zipline, as some of you may know, we're actually an automated logistics company. We started by creating, designing and manufacturing drones, but we really offer a service, a logistics service to countries and ministries of health. We've been operating in Rwanda since late 2016, where we have the world's first national scale drone delivery network, and started by delivering blood and looking at now expanding to delivering all essential medical products, so medicines, diagnostics, consumables, small parts and equipment as well, to really create a more responsive supply chain. And that's what led us down the path of actually creating analytics tools and software for our clients. It was really a customer-driven approach where we recognized that they needed a way to It started first with blood, where they needed a way to monitor their blood system from donation to usage. And so we ended up creating a portion of that software, and the government created the rest of it. Specifically, we created a way for them to order and kind of keep track of that inventory. And we provide all that data back via an API. And second, something that kind of arose almost tangentially for us is an analytics software, which is that we, in the process of actually working with countries and demonstrating the value we can provide, we were doing really deep analyses of their supply chain, pulling manual paper records, looking at ELMIS data and other sources. And we created internal tools that have now become useful to our customers. And so there's oddly a way where Zipline can start providing that as a service, although we haven't started actually offering it. And ways to gain insight over time about true demand signal. So anyway, that's why Zipline is on this panel about IT. We are in Rwanda, but we have a number of other countries that we have yet to announce and will do so shortly to basically increase our footprint by almost 10x. A simple story of kind of the impact of Zipline is really ultimately comes down to the patient, right? So we have had so many young mothers come to us who just straight up walk to our site, our gate, to tell us about how they were saved because of the service that we offer. One particular patient is Alice, who was a mother that actually lives close to our site, would see this service operating day in, day out, the drones taking off and landing, and never thought she would, need blood, but unfortunately experienced postpartum hemorrhage, and we ended up doing a massive transfusion for her, and so she, received blood, platelets, and 6 deliveries, and ultimately was saved, and she came to visit our site with her young son, which ultimately that's why we do what we do. So.
Thank you. Connecting that technology to the actual impact on an individual's life, that's great. So I hope this gives you a broad perspective of different kinds of information technology solutions, and you've been already noting some questions. We've prepared some already, and again, the focus here of the panel is understanding practices for adopting information technology, making it a solution, making it useful for organizations. So I'm going to dive into the boring topic of implementation, because that's often a challenge. You see all these new solutions and the features look great. We'd love to have this, but how do you actually implement it in your organization? So maybe if you could talk about one of your successful implementation stories, and really, more importantly, what were the enablers of a successful implementation, so that other organizations in the room can be thinking about what they would maybe need to do or be in preparing to adopt some of the kinds of solutions that are offered here. So who wants to jump in first?
You can go. Yeah. I think I would like to talk about our India implementation. So yes, we have this product, and you have close to 20,000 stores where you're going to train every person to operate on this mobile app. And many of them have not seen a phone before, right? You're typically talking about 60, 70-year-olds, 6th or 7th grade passed out, and how do you go about training them a cell phone? Some of the cases we observed is where we tell them how to enter the password on the phone app. So we build manuals starting from there all the way to how you're going to enter your inventory updates into the system, or how you're going to take feedback from the system to understand, right? So you have to put the human who is at the center of all of this and build your manuals or training programs around this. I think we have a toolkit that has been published. We have a team called Customer Success Team that works on building toolkits, the training toolkit or the deployment toolkits for country to take and start from there and customize specific things if they have to. So there's a toolkit that has been published out online. You could just take it and it tells you exactly what processes you need to take to start deploying, and we have replicated the same model to several other countries. As we go on, we realize continuously optimize this toolkit that we have been working.
So what's in the toolkit exactly? What are the actual?
So what are the toolkits? So when you're deploying software at this scale, so it includes things like you have to start from purchasing mobile phones if you're going to give that to your end users. What types of phones you should look at, what quality, what price, where you can buy them, what support personnel you need in the system to help all of these guys, what sort of training programs you should run, and how frequently should you refresh your training programs, and who will monitor at each level, what level of supervisory controls you already have, who can help you look at this person did not enter data, we're not getting data from there, they have challenges with the entering system. Do you need an additional layer to begin with? You can start off giving an additional layer. In India, we did something called vaccine cold chain managers who are provided to each state. So they go and audit everywhere to make sure everything is being followed. They support the government personnel, right? They really act as enablers for everybody to adopt. And over a time, their role kind of fades off and government owns it fully, right? So this and all the other details.
So good to help them prepare in terms of hardware and technology, but also the personnel and the requirements for training.
Yes.
Yeah.
Yes.
Tinley, what about your experience? You have a broad community, maybe even the several best practices around implementation given the different members of the community that you've been able to distill.
Yeah, thanks, Jared. Yeah, the Open LMIS community, I should have said this in my introduction. I serve as the community manager, but what I mean when I say the Open LMIS community is that Open LMIS is not just a software platform or tool, it's also a community of partners. So at this point, we have over 20 partners, some of the sort of leading names in global health who are part of this community initiative to build the software. Those partners include Village Reach, JSI, ONA, with support from USAID, Gates Foundation, Rockefeller Foundation in the past, the Clinton Health Access Initiative. So some of the leading names in global health implementation are part of the community of Open LMIS. And so these partners all bring extensive experience in their own ways. And in Open LMIS implementation specifically, certainly we have different partners who have different experiences with implementation. The two sort of earliest deployments of Open LMIS were through JSI with the USAID Deliver project. And those are national scale deployments, so managing all logistics processes for all health facilities in both Tanzania and Zambia. And that's for all of the vertical health programs in Tanzania. That does also include vaccines. And then most recently in Malawi, like I mentioned, Village Reach and Chemonics were the deployer, the implementing partners of the version 3 series, so that most recent rollout of Open LMIS. So in terms of setting an implementation up for success or some of the things to consider, just some of the lessons we've learned most recently from the deployment in Malawi were for having empowered and trained healthcare practitioners and logisticians. So a lot of the presentations we've been seeing over the past couple days have been around workforce support and training and retention and really having trained people who have experience in their work. So having those trained, supported healthcare workers, I think, is an incredibly important piece of the puzzle. But then also having standard operating procedures in the country. So when you're talking about LMIS, it's a broad field. And there can be a lot of sort of considerations and ways that different countries go about their LMIS practices. So having a country sort of have a more standardized way of approaching their LMIS processes, I think is a really important piece for setting ourselves up for success. You also just mentioned a toolkit. Open LMIS has also released an implementer toolkit, so that's available on our website, and that draws from the experience of our partners and our implementers. So we've really taken the best practices, the considerations, sort of the budgeting, the overall vision for an implementation, and have tried to put that together as guidelines for eLMIS implementation. So be that Open LMIS as your logistics system of choice or another electronic LMIS or eLMIS system, there are sort of standard ideas or guidelines or best practices around that implementation.
Okay, so do you also have some other things around the type of hardware requirements and the personnel and so
Totally.
forth as well. But meant to be representing a broader set of stakeholders. and
Exactly.
experiences. You mentioned standard operating procedures and processes. And I've spent some time in software, the software world, and the hardest thing to change is how people do their work, right? And software requires you to do that oftentimes. It has a very rigid way of operating. So maybe you can talk about that a little bit more. Maybe if you want to add something to that, Sean, around which processes are critical to understand when implementing an LMIS.
Sure. Processes that are critical to understand when implementing an LMIS. That could be anything from kind of the basic activities with resupply, fulfillment, and often these countries have sort of standard operating procedures, but then there's the way that things are actually done. And so I think one of the challenges with software is how do you walk that line between what you're supposed to do and what actually happens. And I think maybe some of my fellow panelists would agree or have something to say about our role as software developers and implementers in designing responsive software. So user-based design that actually meets user needs while trying to sort of toe that line with standard operating procedures and sort of best practices. So I think that's something to really keep in mind is how do we lead by example with our development and our design. That can include standards-based development, so really looking at some of the global standards for interoperability between our systems, but also how do we design software that's responsive to user needs but also demonstrates those best practices.
So do you have, in the toolkit, are there tools to help people understand? Because a lot of times people don't even know their own process necessarily, how things are actually done and how it varies from one field office to another. Is that part of your toolkit, either of you, in terms of that process?
So in our recipe, it clearly specifies exactly starting from what is the expectation from the last mile person to enter data. If you are doing session-based, in RI, routine immunization, you have the sessions that you organize. So typically the data entry expectation from them would be within 1 day of the session you have to enter data. This is one procedure that country could define depending on what level of or how frequently you need information. That's a configuration that governments or the supply chain owners can choose to do. And then I think some of the key things that she mentioned about replenishment cycles, all of this is predefined and you configure into the system. We need 30-day delivery schedules. You could schedule that in the system and orders get automatically created. And you just have to make sure you ship it when the orders come to you. So I think the primary focus is also about, how do you make the system work along with the process rather than having to take a process and then use the system like this on this day is actually what you are saying is going to be very hard.
You're a developer here. You're telling me that your system adapts to how people, or do people adapt to how the system works?
Right, so we evolve. Initially when we said, people were told you have to create this order on this day, but now where we are, the orders get created automatically if we notice somebody is hitting their reorder points, right? And if we have a complementary fleet management system that could get an order placed to take the shipment away and your drivers are connected, right? So the system evolves, the SOP also evolves. And some of the other standard operating procedures, all of these are derived from the KPIs that government has for their supply chain. Is 99% availability okay, or do you want to go to 100%, but at what cost? So everyone makes their own decisions. Based on all of this, you define, okay, it's fine to have this amount of stock at each level. I would like to buffer at this level. So all of this gets into the standard operating procedures. So,
and I've had some experience myself with the implementation and just this issue of understanding process mapping. Do you use process mapping at all? And after you map and visualize the processes and help the organization understand what they do now and what the software does and contrast that? Is there something that specific around the processes?
Yeah, in implementation, certainly I think that occurs, but just you mentioning process mapping brings to mind a really interesting activity that we did in Senegal, where we brought in EPI managers from 5 Francophone countries, and we brought them together and actually went through a user-centered design and mapping process for resupply. So when a district or a regional logistician or pharmacy tech or depot manager is making a decision about resupplying product in either a push or a pull system. What are those processes? What does that map out? What does that look like? And that really contributed to the design of OpenLMIS and trying to be responsive to what elements actually have to be considered, not just kind of the ideal, the standard procedures, but also what actually occurs. And that really was incredibly valuable to hear that perspective.
That's a good point. Focusing on those decision points. Anyway, in the end, the software should help be a decision support, helping people make decisions that are better for the overall supply chain. So, Sid, let's pivot to design and planning software. A little different than management software and so forth. What's the implementation process for that?
Sure. So when we think of implementation, we think of two interrelated elements. Data and people. And let's start for a moment thinking of private sector implementations, and then I'll come to what we're doing in public health systems. So when typically in the private sector, a large company will acquire licenses of our software and then train up a team of supply chain designers, center of excellence, who will use the software, and then also we will have a separate data pillar which will integrate with all their data systems to pull that data in for analysis. Now, why do I say the data and the people are interrelated? Is because the people are the critical quality checks on the data. Does the data make sense, or are you just doing analysis on meaningless data? So I think that's a very important layer, and setting up that data for the analysis correctly is still a people-intensive task. Now, what about in public health systems? How do we think of implementation? That model of handing over licenses and training up teams for public health systems to use our software, honestly, it hasn't worked well for us. And that's failures. We are being responsive to it. So when we think of implementation so far in public health, it's still been, we do the analysis, we provide the recommendations. Where we've tried to hand over software, we've had trained people, but then we've had people turn over licenses not being used, run the same training several times over a couple of years, but still doesn't quite have uptake. So how do we be responsive to that, right? In response to Tenley's, we need to make our software much easier to use. Not just a little bit easier, but substantially easier. And so we're moving towards that, where we just have an app dashboard that you just hit a few buttons and can move a few sliders for your particular question of interest. You're not exposed to all the complexity of the tool, so that it's significantly easier to use. And then on the data side, we still need to continue working on that hard in public health settings, because we still definitely have quality and cleanliness issues with data. But we're building data tools to flag those and highlight when there are clear discrepancies or unexpected inputs that are coming in.
So the implementation is really very much supported by the organization here. Lamasoft very heavily involved, and then a little more about you're changing the nature of the software to make it easier to implement.
Right.
Because believe me, I have a background in engineering, know this kind of space. Sid also has a PhD from MIT. I have to admit he was in our department there. So you shouldn't have to have a PhD from MIT to be able to run the software. How do you transition? Like, what is the? Because there's still a lot of analytics behind it. How do you define which simple interfaces are most important in accessing the capabilities of that software?
It's really driven by the problem that people are trying to solve. So when I think of it as an app, This is the model we're moving to, where we have the planning app, and it's very narrow. You're not going to be able to solve all the questions that you want, but if you want to keep rerunning how you're doing vehicle routing, then you can just take the orders or the deliveries for that cycle, import that data, and then hit run, and you'll get a map and a list of your routes. So we're not exposing all the complexity, but you still get the value. That's
So
the
you
idea.
define some key decisions, and then the data required, and make it simple just to say around a specific decision and data. Linking those together. How many different, you have a certain number of different specific kinds of questions you've articulated yet?
No, it's still building that menu, but there's probably maybe 3 or 4 different types of questions that we've already built apps for.
Back to that decision points, right? Identifying decision points. For you, it's essential to identify the decision point as a starting point for accessing the software, and then the data requirements that come from that. So.
And may I add something? To make the process easier, we got a team on board that's doing gamification. So even gamification to support the deployment of our software. So they're developing tools that make it easier for the implementers. And in terms of gamification, if you talk about app development, is just to ease the process of intake and make it more user-friendly and all that. So that's something that we've been using in the core business, and that we're bringing in also in the products.
Can you say more what that is specifically? What do you mean?
By gamification?
Gamification, yeah. What is that?
Okay, well, I'm not the tech person here, so I'll explain it the way.
Organizations out here, what does that mean?
Okay, well, gamification, it's an approach to make the tools more fun to use, basically. It's, I mean, it's really inspired by the game world that seems to interest a lot of people of all ages. So it's just to make these tools more user-friendly, more fun to use, and that's something that can be developed also on, depending on where you're deploying. If you're deploying in Mali and there's a TV show where, there's a taxi going around and telling stories, and maybe the application to teach and train the people will be inspired by that show. And I'm thinking and talking at the same time. I'm just trying to give you an idea, but...
I'm just trying to imagine serialization, tracking, and tracing.
Yeah.
Well, you got to make it fun,
Yeah.
If you just keep on talking technical terms.
So next year's conference, you're going to host a game night, right? Game evening for all the participants.
Yeah, we'll make a demonstration.
That sounds good. Drew, you're not necessarily implementing solutions, but it seems like you've developed them and you're trying to offer them. Maybe talk about that transition you're in.
Sure. I think one of the interesting things is we roll out our service to the facilities ourselves, and what that offers is an opportunity for us to just A/B test a lot. So we're very quickly able to try. So I'm talking purely about the Zipline kind of logistics service to be able to order and receive products. So a lot of these facilities are in pretty far away places, which is why they have the issues that they do. And so for us to go there and train them and try to onboard 500 facilities in like 6 months is like, it would take a lot of effort. And so we are able to try just different ways of trying to centralize the training, trying to do remote trainings with mobile phones, trying to quiz and test them. And our version of gamification is, interestingly, people view working with Zipline as like, a really important marker of their quality and status. So we're able to then enforce, essentially, make sure that they maintain their commitment to us. So, and what I mean by that is that they don't over-order and follow the rules in terms of ordering and managing their inventory. We're able to basically now say something along the lines of, well, to be considered a lab manager who is in good standing with Zipline, you need to be able to show that you're not over ordering XYZ, and then like there's a certificate that comes every 6 months or something like that, right? So really just using the fact that, honestly, trading on the fact that Zipline for them is like a really cool thing, and then using that as a way to do trainings and enforce standards is something that we've been playing around with. But then the other piece around, finally developing software that we provide to our government, central level ministry clients, that came about honestly because of failures. So Sid, when you're talking about, when you tried to use the same software and let them implement it, it didn't really work. Well, we tried, one of the things we hear all the time is, oh, we really want real-time data. But what people mean by real-time is not true like software real-time, which is like second to second, completely synced servers. They just mean they don't want it like 6 months later. They just want it like a month later or a week later. And so, and they want data that's actionable. And so when we initially took them at their word and it just gave them an API that gave all of our data like right away, they weren't using it at all, which was, we were like, well, what's the point in that? And we're like, well, we can look at our software or look at the data and make interesting assessments about, let me use a very specific example. So Zipline, one of the things we do is we're able to decentralize care to where people live, right? So they're able to now get plasma or platelets or medicine or diagnostic at a health center instead of going to a district hospital. But because they haven't, these health providers haven't had this product before, they don't necessarily know how to always use it. So you have differential uptake and ordering for that product. So the interesting thing is we capture that difference in ordering behavior and pattern across facility at the provider level. So now what we can say is, well, we should go target XYZ facility and these doctors to bring them up to speed on, massive transfusion or on treating, whatever condition you want to think about. And those are the insights that the customer cares about. Yeah. And we are pulling them out for our own use, and then as a process of doing that, we then end up starting developing the software and formalizing things that we were doing in Excel and Google Sheets. And now we're like, well, would this be actually useful for you? Because what people care about is actionable information.
Well, it's interesting, the role of analysis. Everyone wants data, but then who's the analyst, to use that, and a lot of times we've thought about, well, you have your data, you have your analysts in there, but it sounds like, you used to mention your software too, you're suggesting things, you're doing analysis and suggesting things already, not assuming there's going to be an analyst in place to take all this data and use it. So it seems like that's a common thread here that, trying to identify those things, and maybe you're doing it already in the back end and you offer it up, or around specific decisions, trying to anticipate what information would be useful and not require a person to be actually identifying those things.
Yeah. One thing that, Prashant actually brought up when we were having a conversation earlier was just there's such a push towards decentralization and putting the onus and the burden on the logistician or the health worker at that last mile. And actually, we don't think that's the right model. We think we should take some of that complex task. They have a lot of things on their plate already. And if we can remove some of that complexity and Zipline can take it on and our software can take it on, I think that's what Logistimo is suggesting with these automated reminders saying, well, your inventory is XYZ, and make it an actionable thing. Because that they know and care about. They don't have time to remember that it's the 7th day after the full moon to check on the inventory. By doing that, I think is actually where we're able to have a lot of impact. And it's a counterintuitive thing, and I think that's the theme I'm hearing.
But it also provides that kind of feedback to a user who may not have the skills or the interest to be able to do the analysis, but then they get something that they find useful and presented. Right. It's not like a narrative is what you presented.
Yeah, it's exactly like
this has been happening, why don't you think about this, making it more of a connection to their daily job.
Correct. And because some of the things are so hard to understand even with the system. For example, your remote temperature monitoring your fridge and you're having excursions occasionally or every hour, but you don't know what was the cumulative exposure of your vaccines or medicines. So you would open a graph and look at, okay, this is the total time, but if I'm looking at hundreds of facilities, who has the time to do all of that, right? So you summarize all of this and say, I found these 10 stores which had a cumulative exposure of more than 6 hours. Why don't you call them and ask if they have taken any measures, right? Send a message to cold chain technician automatically. In the app, they just click and there's a call button next to it, message button. They take care of the actions right there, right?
Do you find that it maybe is useful to have at least, not decentralized, but have one person in an organization who's also working with the software to make sure those messages are appropriate and,
Yes.
and that anticipating ones that maybe not exist, maybe customize, is it easy to customize for an organization to say, I'd like to have these kinds of messages coming out of the system because they know their user base better than Logistimo might?
Correct. So there are all of these standard events that are configurable and customizable. You could say, I want to get alerted before 10 days, or this is my cumulative exposure, this is what I want to track. I want to know when the users do not log in for more than 3 days, right? So there are at least 20, 30 different types of messages that you could configure and customize based on your thresholds. And all of this is local language also. You could change it to your custom language, and so they understand exactly what it is.
That's interesting. One other boring topic before I turn over here, standards and interoperability is something else we talked about. Maybe Tenley and Sharon can talk about this related to health management information systems, country requirements, and so forth. And I mean, Julie, you can talk about with serialization, track and trace, there's a lot of regulations and standards out there, and how do you embed standards in your software? What standards would you like to see? If you had a magic wand, you could wave a magic wand and standards would exist and people would agree about them. How does that play a role in software? Maybe we'll start with Julie about the serialization and track and trace first.
Well, we really think that the standards that have gained the most traction and they've been developed, been used for many years are the Global Standard 1. We really support the use of these standards, but it's not a magic wand to say let's adopt the GS1 standards. There are some steps to be achieved, but I think, like you mentioned, interoperability is really crucial. If we, as interoperability, we're able to act on data faster. One of the main issues that you guys know better than I do from yesterday is when you had the Ebola crisis. One of the main issues is the lack of interoperability between all the new digital tools that were out there. That was one of the big lessons learned. And I think that we here, as implementer of systems that are reinforcing supply chains, we need to reach a consensus on which standards we should promote. And at the same time, when you're looking at what USAID is doing with the reinforcement of the supply chain, they're working, there's the Interagency initiative. They're supporting these standards, so we at Uptel think we should align with this and just move forward. Of course, we're already deploying the standards with our solutions automatically, but there are other there's GDSN, which is a data synchronization system.
GDSN?
Yeah, that serves maybe as a first step to be able to review the master data of whether it's a hospital system or a country medicine system, to be able to seamlessly adopt the standards after. But I'm not the tech person, and when I read about this, I understand. When I explain it, I'm not sure I'm being clear, but
But it's good to hear that
we're available.
they're playing an active role, and they're trying to connect with these new market opportunities as well.
Yeah, and things are advancing on the continent. Rwanda announced, I think last month, that they were going to move forward with the adoption of GS1 standards. We're engaging with some stakeholders in Kenya and Nigeria that are also advancing with the adoption of the standards and serialization, even though there's no regulation in place. And of course, South Africa just published that they were going to start adopting serialization. And let's not forget Ethiopia, that has been really at the forefront of this, as well as India. So there's a lot of action.
Yeah, and in order to trace across global supply chains, you're going to have global standards. It's important to see how that's happening. What are the cases you're seeing for interoperability? Where are the needs, and what are what are the issues there?
Yeah, certainly. And also about the magic wand, I thought we were going to get one here at the conference. Maybe that's not. As a speaker, we were going to be given one.
We're in the Alibaba country. So
yeah.
no,
there's certainly many cases for interoperability, and I would just start by saying that, as an initiative, this is one of the primary tenets and visions of the Open LMIS initiative, is to try to drive forward standards-based development and interoperability considerations. And I know interoperability has been kind of the hot word for a while, but I would add to that standards-based interoperability. And so some of the use cases that we've seen in implementations just with existing systems could be anything like a mobile solution like OpenSRP that does mobile data capture, systems like DHIS2, which operates in 60-plus countries for HMIS data. ERPs, warehouse management systems like Sage or Epicor, so being able to draw data from those for fulfillment. And then also remote temperature monitoring systems for vaccines like NextLeaf's Cold Trace. So those are just a couple examples of some of the systems that are operating in these countries. But as an initiative, I just can't emphasize enough how important we believe standards-based development is. And I think some of the fellow panelists would agree that, as software developers working in this space, we have a mandate, I would say, a moral mandate to develop our software in a way that sets countries up for future success. Maybe developing with standards won't address immediate issues of interoperability, like in the Ebola crisis, but being able to set these systems up for success with future integrations and interoperability, I think is really one of our key visions. We don't believe in a one-size-fits-all system. There can't be a single system that can do every sort of piece of visualization and patient data and logistics data and sort of gather everything. There is no magic wand, there is no magic system. But what there are best-in-class systems that operate and manage the particular pieces of data that they do. And what we can do as developers and designers is set up those systems for success to work together in the best way possible.
Good. I want to turn to questions from the crowd. I will say, Sharad is probably chomping at the bit. I know before. As a developer, he's very much supportive of standards. So I encourage him to talk about how he's doing this at Logistimo, really thinking about how to incorporate standards in this. And then the Open LMIS community. I mean, is this community open to a broader set of, not just Open LMIS users, but there's probably a good discussion around this in general for any companies that are looking at it.
Absolutely, and there are organizations like OpenHIE which are dedicated to interoperability discussions, and exactly.
Good. Questions from the audience? Yes, we have a microphone to go around. You can speak loudly, Prashant. Yeah.
So, I think it's two somewhat divergent views of the world. One being that the needs of technology in the health and humanitarian sector, especially for needs of health and humanitarian sector, especially in low and lower middle income countries, are unique because of the context, infrastructure, that we need new types of technology. That's one view of the world, and there are companies here which demonstrate that that is the case. A second view of the world is supply chain processes are supply chain processes everywhere. They are the same no matter which context and geography, and there are companies here which demonstrate that as well. So I'm not saying we will find an answer to which of these is the right view of the world, but it will be useful for the panelists to reflect on, especially the ones who work only in one of these. Should we imagine a state of the world in which Logistimo, OpenLMIS, Zipline will also be helping solve health and humanitarian logistics problems in the United States, in Europe, where they are at times as grave and as important as they are in other countries, and I'm guessing Lamasoft and Optel already are in both markets. Thank you.
Good question. Other questions? Take a few here. There's one over here. There's one in the front here. Yep. Whoever has a microphone speaks. Yeah, I agree. Yeah.
I yield. All right, real quickly, Kevin Eder, UPS. My question is for Julie and the Optel group. First of all, thanks for introducing a new term to this group with the gamification. We like that. But it was interesting during Jared's introduction of you and in your remarks, you also introduced another term that I think falls under that best practices category. And that is you guys are a registered B Corp. And I don't know if everybody in the room fully understands what a B Corp is. That's kind of an emerging business model. And to the degree that you could speak just very briefly or a little bit about that, because in this world of public-private partnerships, that is an exciting new way of doing business.
Good.
Thank you.
And we'll take the question over here too.
Okay, so I have actually a couple of questions or comments, and the first one, countries are now investing a lot of, millions of dollars on LMI solutions. Is there any, cheaper solution which wouldn't require, license fees? Because some solutions being, implemented, rolled out, but countries are phasing them out because they cannot pay the license fee. And now we have blockchain, it is, a technology which can replace ELMIS. The second question is servers versus cloud-based. Countries do not trust cloud-based, hosting because of patient information, data security. So how can we ensure that countries have confidence in using cloud hosting? The third is open LMIS versus off-the-shelf solutions. We want to have a solution which is one-stop shopping, open LMIS usually needs a lot of improvement, you need to hire engineers. So what do you suggest? Should countries go for an ERP, a solution which can help them manage their supply chain in end-to-end or open source? Thank you.
Okay, good. Maybe take one more in the front here.
Thank you so much. My question to the panel is, how would you recommend management of expectations? I come from a pharmacy background, and it's pretty well known that even if I discovered a novel drug today, no one's going to expect it on the streets tomorrow. But I find that with information technology innovations, people have very unrealistic expectation on how soon a finished product will be ready, whether it's open LMIS or UAVs. Now, how would you advise someone to manage those expectations? If I went to meet the president of a country tomorrow and told him there's a novel drug, he's not going to tell me, so let me build a factory tomorrow and we start producing. He knows there are regulatory processes and things like that. But if I told him there's a potential software-based SMS system, they want it ready tomorrow and perfect without any flaws. So how would you advise one to manage those expectations? And how can we have them rolled out really so that people understand information technology is not instant. It's like everything else. It needs to be developed, tested, piloted, fixed again, then rolled out.
Okay, thank you very much. I'm going to combine the first two questions into kind of a common thing around where we see things going forward. And I want to close on that. We had a question that we didn't get to that relates to that. I'll start with the last two, though, in terms of, you talked about specific things around licensing, cloud hosting, and so forth, and then also expectations management. How do you set expectations, and what are the issue? How do you address the issues that were raised in terms of cloud and so forth? Any thoughts on that?
Yeah, sure. I mean, first of all, paying $1 million for SEM solution, is that in the context of SEM, or you're talking about a lot of others? That seems to be very costly. One of the ways it can really get cheaper is if you adopt one open source based solutions, right? Then there's no really license fee attached to it. The other thing you would need is, what is your IT infrastructure going to be? Are you going to build your data center, or are you going to use something that already exists in the country? what amount of servers do I need, who is going to manage it, who are going to be the IT support personnel, right? So this is exactly where the SaaS-based solutions come in. They take away all of that need, right? And you use, for example, Logistimo's IT technical expertise to manage your platform fully end-to-end, yours and all other countries that are all the same SaaS platform. So it's going to be multiple times cheaper than to host it in country, right? So this is how exactly you would reduce the licensing cost, right? I mean, there's always the option to take open source. If you have the IT capacity already, you could run it. That would turn out to be cheaper if you're sharing your IT resources with other projects that you have, right? And talking about the servers versus cloud, it's a tricky question. I was still not able to convince anybody that they should use cloud. It's such a hard thing. People are so insecure that the data is out there in the public. But if you really look at it from an IT perspective, exactly the same thing that you would have in a data center. If not, the cloud has better security controls. They have level 4 data centers, which is very hard to get certification. Most of the in-country data centers or tier 3 data centers, they only adopt to certain level of SLA, whereas cloud ones give you much higher level SLA, right? And they also, similar to the things that I talked about you and taking LMIS, there are services that clouds provide that again makes it one level cheaper for you. If you just use their database service, they're going to make it easier for you. I mean, lesser for you. You could reserve the servers. I think without question, if you're doing capital investment to buy servers versus cloud, you're really looking at 10x costlier, right? So I think that would have to sell it by itself. And security, most of the cloud providers have all the PCI compliance, all the best security certifications in the world. Your data is isolated. You are in a virtual private cloud. Only you have access to your data. So these are the things that you would typically go and explain to convince that this is exactly why. It's 10 times cheaper, 2 times secure. What else?
And this is all in your toolkit, right? You've got this all rolled out in the toolkit.
Yeah, we have a slide deck.
The debate about the servers and talking about, I mean, they would be useful because it's kind of a question will come up.
Yes.
Maybe tell me about expectations, talking about that, expectations management. You have a big community. How do you manage expectations of people who see a solution and want it right away?
Yeah, I'm so glad that question was asked. That's a great question. And I would also like to address the gentleman's question about OpenLMIS versus those COTS, those commercial off-the-shelf solutions. That's a great question too. In terms of managing expectations, I'm a mother and I'm going to be a mother again. And I would just say that, I never expected my daughter to walk the second she was born. There are just certain things that we kind of understand about the process of supply chain maturity. And I do agree that that is a really challenging thing to mitigate when you're talking about IT solutions. There is this, I think anyone kind of has this perspective, and maybe it's because of marketing or whatever, that IT can fix it. It's that magic wand again. It's like just throw a system in there and it will fix everything. And I think that's a really important question, and a dialogue that needs to be had with countries is, what is your supply chain maturity? Are you really even ready for an electronic system? And having that evaluation right up front, I think, is incredibly important. So, I would just say that managing expectations really comes down to preparedness. How much can you do with technical working groups, with a vision, with really defining your operating procedures in a country? How much preparation can you do to understand your supply chain maturity and design before you're ready to implement a system? So, that's definitely a question that comes up constantly, and I think we all face that with managing expectations. If I could just quickly address the COTS question, that's an excellent question. The commercial off-the-shelf solutions are certainly a direction I think that things are moving. And I like the gentleman's question also about public-private partnerships. I think that all kind of ties together. The view of the OpenLMIS initiative, and I think the partners that I represent in that community, are that, again, it's about the maturity of our advancement in global logistics and these systems. So At this time, there are systems, OpenLMIS, other open source systems, and my colleague explained the idea behind open source, which was another part of your question about licensing fees. Open source doesn't mean free, but it does mean that there aren't licensing fees and that code and that documentation is available, and there's a nature of sharing. But I think, colleagues and supporters at Gates Foundation have also talked about commercial off-the-shelf solutions and how that might be a long-term vision for this space. Tools like OpenLMIS are filling that space now, filling those needs. And again, it's about that maturity, right? Countries and their own supply chain maturity, but also our maturity as logistics systems providers and what we are designing. We're learning from these countries and these systems as much as they're learning from us. So maybe a long-term vision, 5, 10, 15 years, commercial off-the-shelf, I think could be the direction that things are moving. But in the meantime, these open source initiatives and software tools are meeting those needs, I think, in a very real way.
And there's always that balance between upfront licensing and ongoing maintenance and support. You have to think about that whole picture. For the other group of questions, I'm going to turn left here. This idea, we had a question for the panelists about how do you negotiate business interests with the effort to evolve and create global goods, right? And this kind of relates to the nature of a B Corp being a new type of an entity. Maybe you can describe what that is more specifically, Julie. And then we have two companies that have been creating established solutions for global companies for a long time, moving into the space, and one that's kind of creating new solutions as a logistics service provider. Prashant's question, are both approaches appropriate? Is there a convergence around this, trying to learn from both experiences?
Well, if I talk about the B Corp, one of the basic of being a B Corporation is to be geared towards a triple bottom line growth. And I mean, even though my colleagues here are not like recognized as a B Corp, from what I know about them, they do, follow similar principles. But at the heart of B Corp is sustainability. And there's also the aspects related to social development. And I think that when we're thinking about deploying these technologies in low-resource country and middle-income countries as well, we really need to have the sustainability in mind. It's been a huge challenge in the development sector for decades. It's also a challenge now. And if we don't build a way of operating in these countries and make sure at the same time that the governments and the stakeholders we're engaging with and are uptaking our system, we need to ensure they'll be able to sustain the systems in the long run. So when there's an initial investment, and there are some models where you do get fundings to be able to do that, but when it's the country that has to then pay for the system to run, right now it's still a major issue for some of the solutions out there. So I think that collectively here we need to think about a way, like we're collecting a lot of data. We're making money with that data. We're creating analytics. But the people that we're collecting data from, could we start thinking about returning value in the governments and the communities from the data we are investing from them? So that's something that we should explore in terms of sustainability of the system, and that's really aligned with what the B Corp movement is moving forward. So, we want to contribute to the social development of the communities as well. There's an adverse effect that can happen with the deployment of software, where you may be taking a job from a woman who's been writing all the data on the medicine that was delivered at the last mile post, and that's because that's a requirement from the government. But what happened when, this is switching to scanning a barcode? Are we thinking about retraining that person to be able to do that? Is she going to have the same number of hours? So this is what I think is what B Corp is promoting. That's what we're being more sensible to.
Holistic perspective.
Yeah. So.
Sid and Drew.
Established
company, new company. What do you think? Which is the way to go?
I'll respond to Prashant's question, tying it into the earlier question on standardization. So the question was broadly, I think of it as standard versus custom. And your you're saying is the interesting dimension to customize along the low and middle income country setting, but that's not the only dimension, right? Because even if you're deploying for commercial customers, they all have their own needs. So you're customizing for hundreds of different settings. So we don't think that we have a special need for customization. It's prevalent everywhere, and you have to think about how you strike that standard custom balance. It's by doing what everybody does, platforms, mass customization. That's the way you strike the balance. So that's how we think of it.
Makes sense. What do you think?
So Zipline is, came to Rwanda and to many emerging markets because that's where there's incredible need and because we were driven by a social mission. We could just as easily go to developed markets and be making money there, but I think we came partly because of our social mission. And so we're driven really by, I would agree with basically Sid, it's like every healthcare system is unique. Income level is just one stratification. The other ways that health systems are stratified could be the relative power of the central versus the regional authorities. And so our solution is really customized to our understanding of that customer need. So we spend a lot of time in a consultative process understanding where they're having issues and how we can actually have an impact. So it'll look different in different countries.
Yeah. Well, hopefully you've been able to, as an audience, get a better picture on this, understand how your custom needs could be met by these solutions. I encourage you to come talk with the participants, come to the workshop at 1:30, and continue the discussion about this. But let's thank our panelists for giving us some insights in general on how to approach IT.
Thank you.
Okay, good afternoon. I hope that you had a lovely day, and those of you who went to the IHC had enjoyed your visits. So we're here with the final session of the conference, and I would like to introduce our moderator for our final panel. Paola Goncalves is from the Italian University in Switzerland, in Lugano, and he runs the Humanitarian Logistics and Supply Chain program there, and he's going to moderate the panel.
No. Thank you, Aslam. It's a wonderful opportunity to be here, and we're hosting the last panel of the conference. So I hope this will be both interactive and interesting to all of us. Now, before I start with the presentation of the panelists, I wanted to mention that, unfortunately, one of our panelists could not get a visa. Now, Dr. Hasna Kala, the medical director of the Syrian and refugee projects for the Syrian Arab Red Crescent, was planning to come, made arrangements, and due to visa constraints could not be with us. We were very fortunate that two additional speakers joined us, and we have a very interesting panel for this afternoon. Let me introduce briefly the panelists and invite them to the podium, and then we will kick it off with their presentations. So first I'd like to introduce Rex Alamban. He is the head of sub-office for the International Organization for Migration, IOM, Turkey. So welcome, Rex. Next, we have Simon Koneza. He is the Global Logistics Advisor for the Norwegian Refugee Council. Welcome, Simon. We also have Sarah Rich. She is the Senior Advisor for Sexual and Reproductive Health for the Women's Refugee Commission. Welcome, Sarah. And completing our panel, we have Hussam Shaheen. He is the Head of Private Sector Partnerships for the MENA region for UNHCR. Now, you have the bios for the first two panelists, but not for the last two, for Sarah Rich and Hussam Shaheen. So in terms of kicking off the panel, I've asked all of the panelists to give a brief introduction of themselves, their role in their organizations, and that will give you an opportunity to learn more about them in addition to the work that they have been doing. Without further ado, I'd like to invite Rex to his remarks. Thank you, Rex.
Good afternoon, everyone. My name is Rex Alamban. I'm the head of office of the International Organization for Migration, based out of Gaziantep in Turkey, which covers the southeast Mediterranean region of Turkey. We are implementing programs. For those who are not familiar with IOM, it's the latest international organization that joined the UN system. It joined the UN last year. And it's mostly implementing programs to assist migrants in crisis with humanitarian assistance. It also assists member states with migration management programs and many other related programs to serve migrants. In many emergencies, again, as I mentioned, providing assistance to migrants in crisis. And in Turkey, we know that it is hosting up to more than 3.5 million refugees and migrants, including Syrians, Iraqis, Afghanis, and from other nationalities as well. So we have 4 major programs being implemented there. Cross-border operations, that is serving displaced populations affected by conflict in north of Syria. This is authorized by virtue of the UN Security Council Resolution 2165. We also have a refugee response program in Turkey, again targeting the migrants and refugees inside Turkey. And it started as a humanitarian assistance operations. It is graduating more towards social cohesion programs and integration of refugees to host communities as the crisis has drawn longer. We have HNAP, which stands for Humanitarian Needs Assessment Program, and this is a data collection activity conducted inside Syria to guide humanitarian response planning. And finally, we have the Family Assistance Program. This is a program meant to help refugees and migrants intending to rejoin with family members in Germany. So we help them with processing visa applications. This is our footprint in Gaziantep. We are 482 strong staff, and depending on the season, it can go as high as 550 in Gaziantep, especially when our services are highly demanded during winter time. Just some highlights. We have office assets, we have beneficiary assets being processed by our procurement and logistics unit. But just to mention some of the most demanded items, so it's you can see their tent insulation that helps insulate tents inside Syria during the summertime from the heat and during winter time from the cold. We've also done rehabilitation projects for community centers serving women, families, the LGBTQ communities inside Turkey, and some schools. We have also procured and processed 870 in-kind grants. These are for our livelihood program. As I said, we are graduating from purely humanitarian assistance into community or social cohesion interventions. So it means providing also some economic opportunities and livelihood assistance to migrants and members of host communities. If you do the math, 870 IKG kits, and each kit comprises of around 20 items. That's 17,000 items being processed and kitted and distributed. We have also long-term agreements. That's what LTAs mean. And it's very important as for us operators. Procurement lead time is critical in project implementation and for planning. We have reduced lead times through producing long-term agreements with our suppliers. Some highlights of the items we were procuring and distributing. You can see the biggest numbers would be hygiene kits and mattresses. And again, if you do the math, it's around 250,000 kits in a year. And that is, each kit serves one family, an average of 5. That's over 1 million beneficiaries being served for a certain kit. This is a view of our warehouse in Gaziantep. It's up to 16,000 square meters of storage space. And some operational challenges that I think it's important for us to share. We are operating from Gaziantep and sending commodities into North Syria. And there are security threats there that does not allow us to be physically present when we are doing distributions. So we call it remote management of our operations. We find solutions by, one, employing third-party monitoring units. So basically, Syrian non-governmental organizations helping us check if the commodities we shipped have actually arrived to the communities they are intended for, and they give us reports. We are also developing a commodity tracking system, innovating from existing information technology and available. So it's basically putting codes on packages of the kits, which can be scanned using smartphones and allowing us to know their exact locations when they arrive in the beneficiary communities. We are also developing a community feedback mechanism under the principle of our accountability to affected populations. So we are setting up a call center, and through WhatsApp application, there is internet connectivity in Syria. They can give us feedback, they can give us complaints, they can give us confirmation of receipt of the items we have sent to them. And the communities can also communicate to us anything else that's concerning them. So there's questions about sexual exploitation of abuse and the likes. They can submit reports, they can submit complaints regarding these things. There's also very limited capacity of our boarding crossing points. Again, we are shipping humanitarian cargo from Turkey into North Syria. And there's only a couple of border crossing points authorized by the UN Security Council. And the most used of these, because of stability, one, the security situation is not so good, so the other is the frequently used crossing point. It only allows 20 trucks per day for the whole humanitarian community. So it's not just for IOM, it's for all the clusters, for food, for non-food items, for health, for education, so on and so forth. So one of the solutions we provided, since IOM is also implementing border management programs, was to approach donors who can provide additional X-ray machines to scan cargo trucks. And with this, we were able to open up the border crossing point to humanitarian cargo. Previously, it was we had a limit of 20 trucks per day, and that limitation has been abolished since we've installed additional X-ray machine. And this is very common. The third one is very common, that available commodities in the country do not comply with the international standards agreed upon by the Interagency Standing Committee, or if you've read about the Sphere project, there are minimum standards for humanitarian assistance that have to be complied with. So in this situation, we just have to agree. Whatever is available in the market that is able to alleviate suffering and improve the conditions of displaced populations, we just have to take. So we agree with our donors, with the humanitarian community, if the available quality and specifications of items in a certain market is acceptable, and we go ahead with it. So I end here. Thank you.
Thank you very much, Rex. I'd like to call to the podium Simon Konesa. If you just advance the slides, I think you'll get to your presentation. Next.
Okay. So, good afternoon. Thank you for the organization of the event to give us the opportunity to present our work. Sorry about that. So, NRC was founded in 1946 after the Second World War, and the objective is to support refugees and internally displaced populations. So, NRC by design has decided not to respond to natural disasters, climate change, and also does not work in healthcare. It gives support in education, food security, shelter, wash, and camp management. And according to the growing problem of the refugee crisis, NRC has grown exponentially in the last few years, and actually in the last 4 years has tripled in size. So following the theme of this panel, I just gonna touch very briefly on 3 problems, and I hope that later we will have a conversation about them. So the first one is about the increasing numbers, and I call this the context. And in the top of the slide, you can see that I mentioned urban versus camp management versus hard-to-reach places. It's interesting to point out that, at least in the case of NRC, and I think it's the same for other organizations, most of our beneficiaries are in urban settings. They are not in camps, and they are not in hard-to-reach places. And as the problem continues to grow, I think that we are going to see this trend only to continue. That doesn't mean that in absolute numbers, we are not going to have more people that we will need to serve in these hard-to-reach places or camp settings. But most of them will be set in urban settings. And For the people in this room, it's very clear that the infrastructures and the logistical challenges in these three places are very different. And I just very briefly point out to undersea buys in local markets, like the organization that my panelists just mentioned, and that has constraints about what is available in the local markets, and also a growing concern is, can we actually certify whether there is no child labor and slave labor involved in the production of these supplies that we buy. So the second point is about cash interventions. So these are also a growing trend, and I think that I am not sure that we have plateaued in the amount of cash interventions that we are seeing, but it's clearly a more important factor in our interventions as of now. And this has very interesting implications for the logisticians, because instead of having to do procurement, we will have to do more contract management. And something that also I think we will have to see more and more is to be more involved in doing market research. So it's not only understanding what is available for us to procure, but also if we give money to the beneficiaries, what are they available to find? Do they also find cultural barriers to access whatever products they are interested in buying? And then the last point is I hope we will be discussing whether we believe this is a sustainable solution or not. And the last point is about technology. And I have very widely defined supply-side solution and demand-side solution. What I mean by supply side is the type of technologies that we use for management. So supply chain modeling, machine learning, blockchain, all of which are pretty exciting, and I'm pretty sure that many of us here in this room have some involvement with this. The other is about demand side, is about what the beneficiaries need and how we can interact with them. So the first one is, can we predict where the migrants are going to move and then be able to be more proactive? And Undersea started a small organization in Geneva using physicists from CERN that they use different modeling tools. For instance, calculating if there's going to be an earthquake, how many of the houses will be destroyed, how many of the hospitals, this will put how many people in movement, how are the roads, this type of intelligence. And this is something that other agencies have access to. And the other ones are, as also the previous panelists mentioned, social media. How can we better interact with the beneficiaries? Can we have a platform in which we can better understand what their needs are and where they are? But also in the programs that Undersea provides, education and livelihoods. Can we provide training so that they can learn to code and have something that will be useful in the markets? And we have done some interventions in that. So I'm going to stop there, and I hope that after hearing the other panelists, we can have a fruitful conversation on those themes. Thank you.
Thank you very much, Simon. Next, we'll have Sarah Rich sharing her comments.
Thanks so much. So I want to talk about supply chains for sexual and reproductive health commodities in the changing humanitarian landscape. And so I'm with the Women's Refugee Commission. We're a small global research and advocacy organization based in New York. And we aim to improve the lives of women, youth, and children who have been affected by a crisis, whether that's a conflict or a natural disaster. We have programs in sexual and reproductive health and livelihoods, youth and adolescence, disabilities, and protection. I'm on the sexual and reproductive health team, and this team has expertise in research and advocacy to improve sexual and reproductive health services in crisis-affected settings and for people who have been affected by a crisis. We're also the host of a global coalition, the Interagency Working Group on Reproductive Health in Crises, also known as IWAG. This is a broad-based collaborative coalition of UN agencies, governments, NGOs, research organizations, universities, advocates, kind of the whole range of people and organizations that are engaged in sexual and reproductive health in humanitarian settings. In this presentation, I want to provide you with a little bit of background on how crises tend to impact women and girls specifically, what their specific needs are, and especially what the sexual and reproductive health needs of women and girls impacted by crises are. And then I want to talk a little bit about the supplies angle. So what are the supply chain needs for providing sexual and reproductive health services to people affected by crises? And then I want to think a little bit about how that can be improved before, during, and after a crisis, and how it can be integrated across other health areas as well. So starting with a little bit of background, emergencies have different effects on different groups of people, and they have a disproportionate effect on people who are poorer or more vulnerable in society, and that includes women and children. So women and girls tend to be disproportionately affected by emergencies. And we see that gender differences before a crisis become magnified after a crisis. So we see sort of the same disparities in access to opportunities, economic opportunities, educational opportunities, resources in general, kind of taken to the extreme after a crisis hits. Gender roles and household expectations then impact access to warning systems and rescue mechanisms. They can also impact advanced knowledge of survival skills. They impact health. And we also see that women and girls are disproportionately impacted by negative coping mechanisms following a crisis. So for example, families are forced to prioritize their resources, and girls may end up with fewer opportunities to go to school in that case. Another important negative coping mechanism that we're seeing rising rates of is early marriage, and that's been documented among Syrian refugees. And early marriage, not only does it kind of impact the opportunities of girls, but it also can have serious health consequences. Sometimes I think sexual and reproductive health is kind of seen as a standalone thing, but I want to bring everyone back to the concept that it is really part and parcel of basic primary health care. So when you think of what a basic primary health care intervention seeks to do, it's meeting the basic needs of the full population. That includes the reproductive health needs of women and girls. And by reproductive health, I mean the full range of services from maternal health services to ensure safe and healthy delivery, access to contraception and STI treatment and prevention, as well as clinical management of rape. And I'm talking about services that serve from adolescents to adults. So the need for sexual and reproductive health services and supplies becomes more acute in an emergency setting. It's important to remember that routine sexual and reproductive health needs don't stop in the face of a crisis. So people are still continuing to have sex, continuing to get pregnant, and continuing to give birth. At the same time, of course, just as access to other health services is compromised, access to reproductive health services also becomes constrained in crisis settings. So, for example, people's regular family planning method, the supply chain for that method might be disrupted during a crisis. So suddenly, when they had a pregnancy prevention method, suddenly they don't. And this leaves women and girls affected by crisis at increased risk of maternal mortality and morbidity, including unsafe abortion. Women and girls are also more vulnerable to sexual violence in crises, and women and girls affected by crises face increased risks of unintended pregnancies. I'll note that 15% of all pregnancies globally, not just in humanitarian crises, result in a life-threatening complication. So this is quite a large percentage when you think of 15% of all pregnant women. And pregnancy-related complications are a leading cause of death for adolescents aged 15 to 19. I also want to say a little bit about access to contraception for people who have been affected by an emergency, because I think sometimes people think of contraception as a nice-to-have thing, but not a need-to-have. And I would ask you to kind of think about yourself, and if you were fleeing from a crisis, would you or your partner or your daughter or your friend want to get pregnant in that moment? So we actually see that women and girls of reproductive age who are affected by crises really prioritize access to contraception. That is something that women and girls want. And we know, because there are several implementing agencies who have been providing this full range of sexual and reproductive health services in crises, that it is feasible to provide them alongside the full package of other health services. I want to bring it around to the logistics and supplies side of things. The Interagency Working Group for Reproductive Health in Crises conducted a global evaluation in 2012 to 2014 that provided a snapshot of reproductive health in crisis settings. And there were areas of progress and areas that were still gaps, and we saw that supplies were still a gap. So there were stockouts of products across a variety of crisis settings, and there were particular challenges in transitioning from the global prepackaged reproductive health kits to more comprehensive sexual and reproductive health services and supplies. IWAG and UNFPA both conducted studies in 2007 to try to understand what was causing the supply chain, the gaps, and what could be done about them. And both of the studies found gaps in policies at the global level as well as the national level, as well as within humanitarian implementing agencies, guidance, capacity gaps, coordination gaps, and funding gaps for sexual and reproductive health supplies. So what can we do about it? I think first we have to think about it in the context of the changing humanitarian landscape. So often people think of a humanitarian situation as temporary. As we've been discussing over the past 2 days, humanitarian situations are often not temporary. The average length of conflict-induced displacement is 17 years, and as the previous presenter pointed out, more than 60% of people, or a large proportion of people, are residing in urban areas. So we can't just think about how to provide services in the context of refugee camps. These changes impact how governments and other stakeholders view the issues. So it's not only a humanitarian issue, but rather a long-term development issue that requires full and sustained engagement from a diversity of international and national actors, rather than just from the narrower set of humanitarian agencies that have been engaged in humanitarian settings in the past. Within that context, we do have existing guidance that we can build on. And I'm highlighting here the Interagency Field Manual on Reproductive Health in Humanitarian Settings, which is the accepted standard across the sector for what services should be available. And I'm highlighting it in particular because we, in the past couple of years, have drafted a new chapter on access to reproductive health supplies. This came from feedback from the field that if they were expected to deliver these services, they needed the guidance on how to make sure the supplies were there to enable them to deliver these services. We've also been working under the Interagency Working Group on Reproductive Health and Crises to develop partnerships with people who are working more in the development sector on these issues, given that some of these settings are a little bit more in between. So we've developed a new partnership with the Reproductive Health Supplies Coalition, which is a longstanding coalition focused on supplies for reproductive health. I only have a couple of minutes left, but I want to talk about some of the entry points that we've seen through some of our recent research and in some of this new guidance that we've developed to improve supply chains. And these are I'm talking specifically about sexual and reproductive health, but these could easily apply to, I think, any health area, really. So on the preparedness side, it's important that we identify drugs that are in the kits, the various emergency health kits, and make sure that they're registered within countries. So this particularly plays out for reproductive health products like emergency contraception and misoprostol, which can be sometimes more controversial and aren't always registered or included in countries' essential medicines lists. We can also advocate for policies that allow rapid entry of reproductive health and other emergency health kits. We can pre-position items strategically so that they're available when we need them, but with minimizing potential wastage. And we need to be engaging communities. I think this has been another theme that's come up a lot. Communities are often first responders in any humanitarian emergency. And so as we see an increasing number of people affected by a crisis, making sure that people at the community level are prepared to serve their own communities can help us to scale up solutions. Within acute response, we can collaborate across the health areas on innovative solutions to challenges like cold chains. We can share lessons in last mile delivery, and we can build country capacity on logistics management from the pharmacy level to the national level. And I'll talk about protracted response on this next slide. We've been spending a lot of time discussing the need for us to focus more on transitioning from acute response to protracted response or recovery. And in the reproductive health community, we've focused quite a lot on these prepackaged reproductive health kits, which are sort of meant to be globally applicable, but don't actually reflect the specific commodity needs in any given context. So we are thinking about how can we transition from these emergency kits to more consumer-driven, sustainable supply chains. And for that, we need tools, resources, research on what works. And we are working under IWAG, under the Interagency Working Group, on bringing that forward. Within this, we also need to be working with national governments and local partners. When you're transitioning from using an emergency supply chain to a more sustainable supply chain, we have to be thinking about how to integrate into existing logistics management systems and into existing health systems. We're also looking at how we can improve data collection mechanisms and visibility. So what can we do to better coordinate across multiple stakeholders on coming together around shared indicators that we're all using, shared data collection systems, and better coordination and sharing of that data. And we're trying to take lessons from the development sector, which has been doing this pretty well for 10 years now, or at least better than we see in the humanitarian sector. And finally, again, going back to communities, community health workers have been proven as a good way to improve health outcomes in low-income settings globally, and are particularly important when there's a shortage of qualified providers and health facilities. This is often the case in humanitarian settings, and we can continue to apply this. Finally, we are working on some cross-sectoral coordination. So this is something that UNFPA has been working on, and I told them I would share a little bit about it. They proposed meeting with the various UN agencies that are managing the emergency medical kits to better coordinate and discuss some of the shared challenges and solutions. So they had a meeting, I think about a month ago, and came up with some short and medium-term actions, including mapping the current scope, developing a training and support package, and establishing more regular coordination mechanisms across the agencies. There's a follow-up meeting in September to continue those conversations. Thanks so much.
Okay, we invite Hussam Shaheen to the podium. Thank you.
Good afternoon, everyone. So, all right, here you go. So, I just prepared a few slides at the last minute for my contribution to the audience. My name is Hussam Shaheen. I'm based here in Dubai, and I cover the partnerships, mainly the private sector partnership section for the MENA region. What we're trying to do as a mission for UNHCR is really to try to diversify our partnerships, income, collaboration work with different sectors, specifically from the private sector. In the last 10 years, we were successful to grow our income from $50,000 to $400 million last year. This year, we're aiming for around $445 million. Still, it's a small budget when it comes to the huge needs that we need for our people of concern. As you may know, the total budget this year, or the needs budget, what we call it, for UNHCR, the work that we do all around the world, is around $8 billion. The gap is around $4 billion. As you may have noticed already, I'm a fundraiser, so I talk a lot about the numbers and the needs and the money. So I hope I'm not a total stranger between this group of people. I'll try to talk a little bit about what we try to do with more partnerships, whether from gifts in kinds or what we call operational partnerships to donations, as well as work very closely with NGOs, charities, civil society, and the governments. I'm not going to go maybe very quickly with the numbers. As you know, the latest numbers of the total displaced people around the world, we're talking about 68.5 million around the world. Maybe because I'm based here in the region, I work a lot when it comes on the Syria situation, the Iraq situation, different situations here in Middle East and North Africa. My understanding is that 40% of the refugees are based here in this part of the world, and it's growing. It's not going down, the opposite. And this reflects as well the biggest needs when it comes to innovative solutions, partnerships, and more collaboration among agencies as well as with different sectors of the society. So in a very quick nutshell as well, we work mainly on protection. Usually we try, especially in the last few years, we're trying to highlight what protection is really from a legal point of view to humanitarian point of view to child protection, education, development point of view. So we're trying just to spread the word protection. When I joined UNHCR 7 years ago, I didn't know even what protection meant from operational point of view, and I think we have a mandate really to focus on how we protect people, mainly women and children, and the most vulnerable around the world. We're trying to, part of our work here in the region, we have the biggest stockpile when it comes to logistics here in Dubai and the IHC. I'm not sure if you had some of you had the chance to visit that, but UNHCR, WFP, UNICEF, we have different places here among other agencies, and we're trying to work very closely with the authorities and different logistical companies and NGOs as well who deals with the logistical support to provide the quickest and most efficient logistical need and the humanitarian accessibility for emergencies. So as I said, we're trying to grow the pie of income when it comes to the private sector. We're trying to do this in different innovative ways as much as possible. As you know or agree that it's not really easy for the UN to do innovative stuff on the ground, especially with a very long ago system that we're trying to develop year after year. But I think the necessity of thinking outside the box, thinking of how we use the expertise of the businesses around the world and the region, trying not to be rigid and agile when it comes to from logistics to education to even legal protection to cash-based intervention is really important. And this cycle, I saw myself, especially in the Syria situation, it's becoming more and more important. And we are forced to do that more and more in more flexible way. I mentioned private sector partnerships, but as well as communication. I think the brand equity when it comes to the refugee situation, when we deal about the fear of people who are moving around, not only to Europe, but I think here in the region. I'm myself Lebanese, and I know how much troubles the Lebanese economy, for example, is in Jordan, etc. But then how this is affected, or how this affects the way people or locals look at refugees, look at displaced people, and how our work collectively as civil society, UN agencies, and partners, how we try to change this mentality, mindset, or help to change it, or move it a little bit as well as the problems continues in the situation. So our global emergency stockpile, I thought to shed light a little bit on this, since part of the main topic here is we're talking about logistics. This is really our biggest stockpile in the world. Just now we're having 3 flights going to Ethiopia, and this continues. Part of the work we're trying to do with the private sector is really trying to find cheaper, more efficient ways for transport and how to reach very quickly situations around the world, in Africa, and even in Latin America in some cases. So this is something I think in the development, and in the future of or what we see the future as of the cash-based intervention, as my colleague just mentioned a little bit just while now, is that it's really important for us to see how the humanitarian scene is changing, how the humanitarian assistance is changing. Do we really need big stockpiles in the future, or maybe we want to find a solution how to distribute cash in places where you don't have ATMs, or you don't have even banks. And this is something I know in the discussion on different levels in the humanitarian world. So just to go back one step, what we're trying to do more and more is really focus on unearmarked assistance. This is part of the big bargain that happened a few years ago in Turkey. So we're trying to do, which is a very hard bargain to convince, especially what we call leaders in giving, or philanthropists, to just say, listen, go, we trust you, we're going to report back generally, or what we did with this money. I think the more important part is really to grow our, what I would like to do, and others as well, is democratizing kind of the income from this part of the world and globally through digital fundraising, through face-to-face, through more one-to-one small donations rather than bigger donations. That will always be needed and very important and crucial, but I think the more we have smaller donors, and this is where the 200 million 7 is coming from. This is coming really from people like you and me who can have or pay $5 to $10 a month to a general program for Syria, Iraq, or even for children. And this is really important for us so we can move money around on where it's needed. 1 minute to go. And so this is, we're trying to create partnerships. So maybe I'll just, this is a collection of our global partners, including partners from the region. What we have is, the most challenging part is livelihood for UNHCR. We're trying to, day after day, understand how we do better when it comes to livelihood, entrepreneurship, employability. We have, I'm sure you're aware of the 3RP call to action or portfolio, which is something we do with UNDP, but I think moving forward is really important for us to be agile and put ourselves outside the business when it comes to livelihood. We just need to, I believe, to let go and let NGOs and civil society deal with it, even governments, to employ and train and make sure that the private sector is really interested in giving the opportunity for refugees and displaced in the region. Cash-based intervention, I believe it's the future. It's really growing very fast. One of the lastest thing we do as UNHCR, which was in a way breakthrough, we tapped into faith-based philanthropy. So we asked people to give their 2.5 almsgiving, Islamic almsgiving, to cash-based intervention within Jordan and now in Lebanon. This is something we saw people interested in, and it's about, I think, transparency, impact, how people believe their money is going directly to help and support refugees in the world. Done? Okay. So just to mention two specific maybe partnerships, I believe they are very innovative. UPS when it comes to logistics and even cash contributions, and IKEA on providing the Azra Camp 2017 with a lot of solar panels that will help us to and help even the Jordan government, the Jordanian government when it comes to sustainability. As we know, the camps are not going to demolish when the disaster finished, but it will continue. Thank you very much.
Thank you. So thank you very much for your presentations. And before opening up to the audience for general questions, we talked about discussing some of the issues that were common across the different presentations. And one thing that comes to mind, you just mentioned, Hussein, but it came across in all of the presentations, is the role of innovation, right? So we talked about cash-based interventions and how it can pave the way to how we provide assistance in the future. There is the aspect of livelihoods, both IOM and UNHCR doing that, but we also talked about WhatsApp and feedback and an active engagement from communities. So if you would provide a little bit of perspective on the role of innovations to address this aspect of refugee crisis that we're facing, that would be wonderful. And we can start in any order. If you have a burning desire to jump in, please.
I'll start with frustration, actually, on innovation. So we have, if I may be open in a safe space, so we have an innovation unit that is really starting to try to throw and put on the table a lot of solutions, hopefully, for a lot of problems I mentioned and that I haven't. I think really it's about the change that you do within the organization. So I see a lot of still barriers when it comes to fast solutions. I don't think the solution is about a unit or a team. It's a great start, and they're doing a great job, but I think it's really about having the DNA of the organization, if that's the right word, to change towards fast, agile, more effective solution provision. Very quickly.
So the frustration comes from the barriers and the delay in actually implementing change, is that?
I think so. I think so. I think it's when you have big organizations and big situations that are growing. So if we talk about the Rohingya situations, we having 1 million refugee in few months, and suddenly you have to provide cash-based intervention, and you don't have even ATMs where you are, and you have partners that you might or might not. You need to have this trust element, of course, to be. So how to solve this very quickly? Because the situation is growing very fast. I think that takes an innovative approach, right, to do that. But what's the answer? I don't know. But yeah.
Thank you. Other thoughts?
I would like to just give a quick example about what NRC is doing. So NRC have seen the importance of innovation growing enough so that it has created a position for an innovator advisor, and I think it's less than 2 years old. And for 2 years, what we have done internally is that we have created a small pool of money in which we ask people working on the front lines to come up with ideas about how to better serve the beneficiaries' needs. And the first year, it was, I wasn't in NRC at the time, but I heard that the competing ideas were pretty much standard ideas of, we need a new software and this type of thing. Second year, they decided to use a video model so that people have to pitch in a video what the idea was and how the idea was going to impact. And then internally, NRC employees, which is more than 10,000 worldwide right now, will vote the ones that they thought were more interesting. And there is a little bit of a bias on, voting for the video that is more attractive and better done. But, it's a step on the right direction of putting people to think out of the box instead of having to write a report saying we need this will be great, to actually go and put yourself in a position of an internal entrepreneur in the company and try to achieve that.
Thanks, Anna. I would say it plays a very critical role in management of risks, for example, since humanitarian operation normally happens where there is a crisis. And it took a long time for the humanitarian community to adapt. And, but recently the progress had been very, very rapid, and thankfully. For example, in terms of security of staff, it's one of the most important consideration when launching a humanitarian response operations. And now, for example, we have an app where you can just click that you are not okay, and that data quickly gets sent to an operation center halfway across the world. And someone from there's an operation center, calls the managers, what's happening with this guy? And so it facilitates a lot of things that were impossible to achieve before. And hopefully that will reduce casualty of humanitarian actors in the field. Another is, I've mentioned earlier in terms of accountability to our beneficiaries or to the affected populations. So they are able to communicate now with us. We can communicate with them and explain what to expect from the assistance that we are giving, and also then for them to be able to confirm that they indeed are able to receive what we intended them to receive, or more than that, be able to also tell us what more they need. So in terms of assessments of needs of these populations, it's also very, very handy right now.
Thank you. Sarah?
Yeah, I'll mention the importance of health product innovation, I think, because I'm not sure that's been mentioned yet. But for example, in the reproductive health field, donors are looking into developing new contraceptive technologies, and one of the new contraceptive technologies that's been introduced in a number of countries now is a subcutaneous injectable contraceptive. So basically that means that it's easier to inject than the standard injectable contraceptive method that's now available. And we're thinking about how that might be valuable for women and girls who have been affected by a crisis, because it's possible that this method could be approved for self-injection, and then it could be given to a woman who is on the move, say, and very difficult to reach. So that's a little bit far in the future at this point, just giving it to someone, but I think thinking about new technologies and how they can get to people who are in particular need of them is really important. We're also looking at heat-stabilized products. So one solution is to strengthen the cold chain. Another solution is to not need the cold chain. So what can we do to continue looking into the availability of heat-stabilized products?
So I like to summarize, and what I find tremendous, very insight or very interesting is the broad range that innovations play in the humanitarian sector. We've talked about some services, right? So either contraceptives or how we provide assistance to beneficiaries. We talked about the aspect of security, assessment, and then there's aspect of innovation in terms of changing the process, right? So there was a barrier with respect to 20 trucks because of unawareness of the content of the cargo, but an innovation, which is an X-ray machine, could bring or at least loosen up that barrier, and then the possibility of these not need of code supply chains, right? So thinking outside of the box that are part of the solution in bringing answers to the refugee crisis. I wanted to build up as a last question, at least before opening to the audience, this aspect of frustration that you alluded to, Hussein. And there's two aspects for it. One is that any major organization requires a significant change, right? So there's a tremendous amount of inertia to implement that change. And as you pointed out, the UN system as we know it was designed after the Second World War with specific challenges trying to address. The world order has changed. And we faced a dramatic situation with staggering numbers of refugees. And the design that was initially conceived may not be the appropriate design to address the challenges today. So one aspect is the inertia that we have and the design that was created, put in place for one challenge. And that system carries some inertia. The other one is that we're facing a staggering number of refugees, and trying to address the situation today requires not only innovation, but scale. So, and that brings me back to that frustration aspect that you mentioned. So could you speak a little bit about scalability, right, and addressing the millions of beneficiaries in need and our inability as a system to provide solutions at that magnitude?
I mean, I don't have a straight answer, but I think that you painted in the right color. That is a growing frustration. I think that the growth of cash-based interventions is actually a little bit a result of that inability to give the beneficiaries the services in the traditional manner. Given then access to cash, it cuts down the operational burden of actually giving them this support. And I think it has been proven that it's the most effective. Also, it has a very interesting component of actually unveiling solutions that as a community we haven't been able to foresee. That the way that they use the money show the growing interest in being self-sufficient and their entrepreneurship spirit in actually getting into these solutions. And I mean, this is anyone's guess, but I believe that the camps cannot be scaled that much, and we will have to have more and more urban integration, and that will not be the only thing, because there will be crises in hard-to-reach places that will not be able to be served by cash interventions, and we will need the traditional system. But we are all struggling to find solutions, I think.
Thank you. No, I think, I mean, there's a positive part, which is, for example, the 72 hours response when it comes to emergencies, right? Mm-hmm. And this is something has to do with scalability that happened years ago now, and as an emergency organization to start with, we're doing very well with this, right? And then when it comes to cash-based intervention, in the last few years, a lot of organizations been able to scale up when it comes to mainly Jordan, Lebanon, even Egypt, Iraq, and some other places. A lot of countries. Some places it's very innovative when you have the iris scan. Some places you're giving cash, but this ability even to serve the local economy is really important. So this is scalability when it comes to helping Lebanon, Jordan. Again, that's my narrative every day today. So we're trying to help the local communities to survive in some cases through scalability of cash coming in and being distributed in different ways. But then when it comes to durable solutions, but that's mainly economical solutions, livelihood, training, education, it's still very challenging because sometimes it's about roles and responsibilities, interagencies, roles and responsibilities, with no criticism. It's just, I think, something should be done more and more for us to let go collectively and say, for example, livelihood is something maybe should be done only by the private sector or led by the private sector, and empower the private sector, give them visibility, the space or whatever, working with the government, lobbying the government, advocating, the society to otherwise, livelihood. I've been engaged in livelihood projects for the last, trying to fund actually livelihood projects for the last 5 years. It's really, really difficult because implementation on the ground is really challenging between governmental policies, local laws, etc., interagencies, dynamics, So I think this is where innovation or solution can be by letting it go, or I don't know, outsourcing it, or say it's not our job, but and I don't, maybe, or create another thing to do it. But this is where scalability is not working now. And we should really think about, especially before September, for what's happening in New York on the Refugee Compact events. And a lot of businesses will be there saying, we're trying to hire refugees, we're trying to be online and hire refugees, but we can't because 1, 2, 3, 4, including policy, regulations, etc.
Thank you. Any other thoughts?
Okay. In IOM, I had this misfortune of being deployed to so many humanitarian emergencies. I was deployed to Iraq after the invasion. Most recent, the big Haiyan response in the Philippines. I'm a Filipino, so I was sent from IOM Iraq to the Philippines because overnight, 13 million people got affected by a huge typhoon. 400,000 people lost completely homes. And this is where scalability, I would say, is very critical. How do you launch a large-scale operation given there's no pre-existing structure, for example, in a certain locality? And it causes a lot of frustrations. Your HR system can only recruit so much. It takes 3 months to recruit someone who has some specialization that you need, for example. And generating the stocks that you want to distribute to affected populations. It's also a big frustration when you are told by your procurement unit that you need 6 weeks to come up with so many tarps that you needed to distribute yesterday. But anyway, we had to look to a private sector who's giving us the example and has been leading innovations in how things are done. So, for example, we are now using SAP technology for our HR and our finance. How do you keep track of so many expenditures when you have suddenly so many projects to manage, so many donors to and you want to be accountable to each taxpayer's dollar that came into your lap. So these are the things we had to contend with. And again, innovations are critical in being able to decrease the frustration levels of people working in the field.
Okay, I'll ask Sarah to pitch in, and we're running out of time, so
I'll be brief.
We'll make it quick.
Yeah, I mean, I guess I'll just say we've painted the world in terms of development and humanitarian when that's not actually reflective of the reality. And we have big agencies that are dedicated to each of those different settings, and that structure isn't on the verge of changing. But we can identify more concrete and specific ways to partner and solutions that we can bring to the table. So, you know, bridging the humanitarian development divide is a huge thing that some people hate to talk about because it's a bunch of jargon, and that can be true. But I do think that there are concrete ways we can partner across the sectors.
Thank you. Thank you, the panel. Let me check with the organizers. Do we have time for one or two questions from the audience? So 2 brief questions from the audience and brief replies from the panel. We have a question or a hand raised in the back. If you could introduce yourself and your organization before the question, please.
My name is Andeyatso Kifasi. I work with the Federal Ministry of Health in Nigeria. Okay, my question is about, in terms of providing assistance to beneficiaries, talking about cash-based interventions. How effective has cash-based interventions been, and do you get feedbacks from the beneficiaries on how they use the cash, and how sustainable is the idea of cash-based interventions?
Thank you. We'll take another question if there is another one, and we have a person here in front. So cash-based interventions, are they effective? How is the cash being used? Is it sustainable? Please.
I'm Sharbel Matar from NRS International. We are leading manufacturer of core-relief items. So my question to IOM Turkey, Mr. Rex, you mentioned that you have an issue with the quality of the NFIs supplied locally. What is the problem of going outside? Is it politics or lack of coordination with other UN agencies in order to have the possibility to get good NFIs or what is not matching? Thank you.
Thank you. And one last question over there. So a specific question to Rex on the quality of products.
Thank you so much. I'm Peter from Infectious Disease Institute, Uganda. Coming from a public health emergency background, and my issue is very many public health emergencies, whether it's someone eating a dead cow with anthrax, or bats with Ebola, or monkeys with Marburg, come from livelihood. People are poor and are hungry. So my question is, what can we do to hold host governments accountable that when they take on refugees, they identify for them good places where they can have better lives than on the run? Because there are countries where refugees have been settled in worse neighborhoods, they can't have meaningful lives, and they choose to resettle in, like lakesides, and then they fight with the host populations, and they're eating dead animals or something. Then you have a disease outbreak. So how can we have the principles of livelihood, environmental protection, being codified during these arrangements as they're being made, such that host countries are held accountable for the management of these refugee funds that they have been given through people's donations?
Thank you. All right, so.
I have small story about cash-based interventions. The cash-based administrator in my organization told me about how, in principle, donors were resistant because they didn't know how the money was going to be used. They established these monitoring systems, that they did these surveys, and this story came about this beneficiary that actually got the money and bought a big TV with huge screen. And then they went to actually check if that was the case. And the beneficiary received them in the tent and invite the monitoring specialist to come in. And what he has done is to set up a small cinema in his tent with chairs. And then he was getting a small fee from other people in the camp to see movies. So this is the kind of thing that we could never think. And I think donors are coming around with the idea that actually the beneficiary is in the best position to know what the money should be used for. So just a quick study.
And to add on this, actually, it's about mainly the families that are headed by women usually, a lot of them in this part of the world. And yes, we do have actually, before the program starts in some places, we do have focus groups. So how the distribution can happen, so whether they need an SMS notice, what's the way of communication, who will collect that, et cetera, But then we know after the fact as well how the money is being mostly spent, whether on rent, on debt, on education in some cases, but mainly it's food, rent, debt, and in some cases education and some other needs, especially for winter or winterization. So I think it's very effective. I think the overhead when it comes to on cash-based intervention is really low. We're talking about maximum 7%, but even in some cases we managed to lower it because of some partnerships and donors with banks and other payment systems. And I think this is, the more we do of this, even digitally, the more we lower the cost, the better, so the more the dollar value will get directly to the beneficiaries.
Can I? So the Women's Refugee Commission also works on livelihoods and cash-based interventions, and we've in particular looked at potential risks that come alongside receiving cash, because cash becomes sort of a form of power and therefore exposes people to new risks, both within a household as well as across like a refugee and a host community. So our work has shown that it's really important to undertake community consultations to understand what the risks might be in a particular context, because they can vary across different contexts, and to use those consultations to inform programming. So it's the same model doesn't necessarily work in all settings, but the protection and risks that come along with cash must coincide with design of the program and implementation.
In the interest of time, I would suggest that we close the panel. So please help me welcome or thank the panelists for their contribution today. So, and I'll give the word to the organizers. Oslan, thank you. Thank you, folks.
I mean, do you want to step down or?
Yeah, we're just going to step down and.
Okay, so I would also like to thank the panelists and Paulo. Thank you for a wonderful panel, and all to the audience as well, still being here at the end of the 2 days. And given that it's almost 6 o'clock, I'm going to be, Luke and I would like to close the conference with a few words. So what I would like to do before giving the stage to Luke to really close the conference is just to talk about a few things that I've heard during the last 2 days. So the first thing, given that this is a logistics conference, which makes me, the thing that I heard, which makes me happy, is that logistics and supply chain management is moving to the forefront of health and humanitarian systems. So we are, as a profession, gaining more visibility. And these are, I mean, this is happening because of the scale of the logistics and supply chain management costs, the scale of the crisis that we are dealing with around the world, and then the realization of the supply chain and logistics system strength and agility has, I mean, the importance of the agility and the strength of these systems on the speed and the cost effectiveness of the delivery of aid and public health services. So we realize all of this, but what I've also heard is that due to these recognitions that now there is an interest in more investment in these services. So in the opening remarks yesterday, we heard that IHC capacity in Dubai is expected to be tripled by 2020, right? So this is again kind of an indication of both the level and the scale of the crisis that we have around the world, but also to the fact that now there needs to be investment for logistics and supply chain services. Also, we have heard from in many of the panels and also in the workshops and the presentations, the importance of training, retaining, and motivating the supply chain and logisticians that work in these sectors. And again, 10 years ago when we started the conference, I think this was kind of a novel idea, and now everybody is talking about it, which is great, right? And finally, again, in almost every panel, every workshop, in every presentation, now we're talking about innovation and investment for logistics and supply chain management and delivering services. So many people talked about information technology systems, data management, tracking, decision support tools, but also delivery systems. And even in the recent panel, we talked about new products, delivery systems such as creating the logistical networks in Rwanda, and so on and so forth. So I would say as a community, we are embracing innovation and implementation of the innovation. However, we are faced with new, large, and complex problems. We talked about large-scale and protracted emergencies. We talked about just now the refugee situations being now different because now the populations are refugee populations residing in urban centers. We've talked about new types of emergencies due to changing weather patterns. So now we are actually faced with different problems, so we have to be even more innovative and so on. So one challenge that's kind of close to my heart, because it was one of the earlier problems that I worked on when I entered the sector, is the timely investment and planning and investing before something happens. And I think 10 years later, this is still a challenge in the industry. And we still have a lot to do educating the donors, the policymakers, organizations, and everybody to actually do investment before something happens. We also heard a lot of discussion about the efficiency of centralized response versus the effectiveness of community engagement in a response. And we talked about, sovereignty, like the national sovereignty, local sovereignty versus the global solidarity and the effectiveness of that. So there are tensions that are real tensions, but we have to understand the trade-offs and manage them effectively. We also heard the kind of the frustration of some of the solutions not being implemented right away, also the frustration of expecting implementations to be done overnight, which is not really going to happen. So I heard, I think in today's morning session, about a supply chain management maturity model. And I think that would be something wonderful to kind of have a maturity model and explain to different organizations and countries where they stand in this maturity model and what should be, like how can we guide improvement and expectations along this maturity model. At the end of the day, I think we live in a one risky world, right? So a couple of nice quotes about that. One was, no one is safe until everyone is safe. Local is the global, and we are all aware of that, but this is still something that populations, there needs to be advocacy around this. And we all, although everybody in this room, I'm sure, understands this, but this is something that we still have to convey to the larger audience. And the other thing is, it's a risky world, and emergencies will always happen. You can never be 100% protected. So we need to understand pain points, implementation of existing solutions, and innovative solutions. And we need to invest in preparedness, infrastructure and capacity building, and research. As an academic, I was like jumping up and down with the every time research and the the necessity of research was mentioned on the podium. And of course, always, as represented with the 10 years of this conference, partnerships are, I think, the way to go for solving the large and complex problems of the world, public, private, academic, and global and local partnerships. So now I'm going to pass the mic to Luke to finish.
Right. No slides on my side. I think you had enough of those. First of all, thank you. Thank you for coming. It's a bit boring if nobody comes, right, if you organize a conference. So I'll ask the conference chairs to just stand up and applaud you for still being here, because I take it as a good sign that so many people are still here. Come on, guys, stand up. Ladies, stand up. Applaud our participants. Got to be customer-centric, right? I would also like to thank the organizing team. I didn't do much myself this year. I did in some previous years, but I know how much work is done behind the scenes, not just for organizing these sessions, that's a lot of work, of course, but all the logistics and the organizational things and the contacts with the participants. So thank you a lot for the organizing team, Jocelyn, but also all the others. And now we'll all applaud, and I'll do it too. So, time for a little bit of reflection, right? I mean, let's take a life cycle approach to a conference like this. So there is a first step where you did decide to come. That's an important decision for many of you because the budget is, of course, an issue, and your boss needs to agree with that. What did you expect when you were going to come? Right, so think about that. Then what did you pick up during this conference? What did you learn? And then third one is, how will you use it when you get back? What are the one or two things that you will just take with you, implement? One or two, not 35, right? So it could be insights, things that struck you never thought about before. It could be contacts, a bunch of people in your environment or in other countries that are dealing with similar issues that you want to talk to and get more in touch with. Or it could be best practices that you could just copy or improve, right? So which things did you really learn? Let me give you an example. I was struck, and I could hit myself for being so stupid. I was struck by something very simple, which is the basic importance of basic health. I've always been somebody as an academic working on emergencies and supply chains and, and even in the development context, but what we have to talk about a lot more and think about a lot more is elementary basic health. And this comes back to what Özlem already said, no one is safe until everybody is safe, right? So it's very important to think about that. And I was struck by that. I should have known about it. I should have known better as an academic. The second thing that I was struck with is logistics is just, or supply chain management if you want, is just too important to leave it to supply chain managers, right? So we should train all the people that make use of the stuff, right? And of course, for them, they need to understand what logistics can do and cannot do. So what about training pharmacists, health workers, doctors, in understanding how important logistics is and how they can work together and communicate their needs a lot better. I think that is something that we need to think about. So that's my takeaway, and there's a few more. And so I think it's important for you to also think about that. Second thing I wanted to talk about is about this club of people, these couple of universities and others who are organizing this conference. This was number 10, I think, in terms of the conference that we've done. The original idea was to bring together people from different stakeholder groups, because we thought that they didn't meet very often. There wasn't a good platform for them to meet. And I'm thinking about people from governments, people from NGOs, people from the academic world, people from private business, people from foundations, and so on. So to sit together and have a platform to discuss. That was the original idea. And it still is. And I think, there's lots of opportunity during this conference to talk and coordinate. One of the things that I would like, going forward to number 11 as a conference, first of all, I would like to know if you would come again. I hope you will. But number 11 for me would be, there needs to be more time for networking. I mean, there's a lot of interesting sessions, a lot of stuff that comes at us, but a large part of this conference is also being able to talk to different people. And maybe we could organize the networking a little bit so that we facilitate it for people, right? That's one I would like in the next, the second one I would like in number 11 in terms of conference would be more focused on joint learning. Right? We have been doing an awful lot of things from different perspectives and trying to improve, but we're not very good still at trying to look at things together and join forces to make changes rather than trying to do things on our own. The problems are so complex, the world is so complex today that nobody on his own or her own can solve these problems. We'll have to much more seriously start to work together. So that's the number 2 I think I would like for the next conference. The third one I would like, and this is just me, I mean, I didn't talk to these guys, or a little bit. We talked about the next place to organize this conference, and I think we agree that Africa would be a good place. We are looking into a few possibilities to see if if there is sufficient logistical support and so on, and hotels and so on for you to be there. But that's the next one. But we also have to think about not just number 11, but also number 12, number 13, moving forward. Where do we want to take this? Now, it's not just us as an organizing committee, it's also you as the users or the partners, right? So we would like to ask you to fill out an evaluation form, which will be sent by email. You may have received it already, but it is extremely important for us for you to give us some of the feedback on what was good, what was less good, and what would you like us to do the next couple of years. All right. Now, given that it's already almost 6 o'clock, right? It is 6 o'clock. I will just skip the rest of the comments I had. But the only thing I would like to hope for you is a very safe trip home, and see you again next year, wherever the next conference is, probably, hopefully, in Africa. Thank you.